So I'd like to take a moment to welcome everybody to our Climate Change and Health Forum. My name's Judy Fosseretta, and I coordinate the environmental health initiatives at Magee-Womens Hospital of UPMC, and along with our partners, Healthcare Without Harm, we are happy to see so many of you interested in learning about climate change and its connections to health. Our first speaker is Terry Collins, who many of you may know. It's my pleasure to introduce him. He's the Teresa Heinz Professor of Green Chemistry here at Carnegie Mellon, and he directs the Institute for Green Science. And this institute was established as a research, education, and development center in which a holistic approach to sustainable chemistry is being developed. Terry is internationally renowned as a researcher, educator, and advocate. And his topic this morning is energy and sustainability. Please welcome Terry Collins.
Well, thank you very much, Judy. Yeah, I have a lavalier. It's wonderful to see you all here. Welcome to Carnegie Mellon from our good friends at Magee-Womens Hospital. The program that Judy's running there is absolutely wonderful, and we've intersected now on a number of occasions in wonderful ways. Welcome also to Healthcare Without Harm and Gary Cohen. We're absolutely delighted that Gary could come to Carnegie Mellon and give this talk. And it's good to see a good audience here because this was put together really quickly. So I'm going to discuss energy and sustainability. And my job is to set up the overview for Gary and the other speakers in the morning. So we're going to go up to the 40,000 foot level and above and consider energy. But I'm going to begin with some rhetorical questions. Just ask them of yourself. They're significant in the greatest possible way, in my opinion. First, do you think our civilization, the global thing that we're all part of, that we've built, do you think it's sustainable? Do you think that our dominant technologies, energy technologies, are sustainable? Now, I know what sustainable means to you, but that's forever. These are things that can go on without undermining the civilization forever. Do you believe you're personally responsible for promoting and even demanding sustainable energy? Do you think your organization's responsible for advancing sustainable energy development? I definitely ask that of Carnegie Mellon. And do you think your country, it's your United States, you're the citizens, do you think it's responsible for reorienting its economy towards a sustainable future in energy? Now, what I'm going to do in my talk today is brainstorm about how we, as individuals, groups, and organizations, can think about and engage in advancing real-world sustainable energy. And it's the thought structure of how we proceed forward that's so important. So we'll begin by setting the context. Really, climate change, and this title of this symposium is Climate Change and Energy, is a catchphrase for a whole set of closely related crises. Atmospheric carbon dioxide levels are charging, they really are, charging towards values that portend permanent environmental and societal disruption. Now, the number's 450 parts per million. We started counting in 1959, and we were about 315, 316. 2 years ago, we were at nearly 390. Just recently, at the North Pole, the number was 400. We're going to get to 400 in less than 20 years. Crystal clear. The oceans are being poisoned, killed, heated, acidified, and filled. This is of the most enormous consequence. And this is largely because of the energy type, not purely, but largely because of energy technologies that we're operating. Biodiversity is being devastated. The biggest die-off of species, the biggest rate of die-off of species, certainly in recorded history, but going way back into our distant history. The human population's outgrown the planetary capacity, and the climate change is making that so much harder for us to deal with. The global water cycle's undergoing major changes. Some places are getting much wetter, some are getting much drier, some will win a little bit or be a little bit better off, but a lot of people will not. An erosive corruption, wrenching economic crises, and brutal struggles have become the order of the day. These things are interrelated. They're not single happenings, but they're all interrelated. So you have to ask this question: can any amount of money made by the carbon energy sector today, that's the gas frackers and coal producers in Pennsylvania, other kind of people in other energy areas and carbon and other places, can that ever compensate for the injury to tomorrow of climate change? There's no doubt about climate change and what it means. Can anybody possibly, any amount of money that anybody could make, possibly compensate for that? So this is a critical point about sustainability, because if you look at what I just put up on the screen, you could conclude it's hopeless. Things are so bad that I may as well just go home, go to bed, pull the covers over my head, sit in front of the TV, do whatever. We're never going to be able to fix this problem. We'll just have to go along for the ride and see where it takes us, and that'll be it. That's one conclusion. But in actual fact, sustainability is not, because it's about forever, it's not about where you are at any given time. It's about where you're heading. And that's the enormously optimistic thing. The direction's what's important, not the place at any given time. And so really we're talking not about a map, we're talking about a compass. And I introduced this compass several months ago to try to help people think about this. So you'll see that we'll build the compass in real time as we talk. The compass, my thinking in this is based on two people I think very highly of, Stephen Covey and his co-authors, who Stephen Covey argues, you'll find his books all over Barnes & Noble shelves, argues that the problem with American professional life is that people are stuck with the clock and responding to the clock rather than the compass. They're busily thinking about doing stuff by then, get that report in, do this, do that by then, rather than about where they're heading. And that a huge amount of dissatisfaction professionally is coming from that. That's true of our civilization as well. And the second is Karl Henrik Robert, the founder of the natural step. And what Karl Henrik did is produce 4 very simple principles for sustainability. And this compass honours those, as I will show you. The compass, as we build it, you'll see is very valuable for comparing technology. We're going to lose the top of the slides because of the curtains. We need to do some work in this room. All right. So it turns out there's 2 ways that things can become, technologies can hit sustainability, certainly in the energy sector, but basically it's true everywhere. First, they can be physically or chemically degrading, like so. A really unsustainable technology will have that needle pointing towards the south. Now, that's where coal and oil are. Both of them are incredibly physically, chemically degrading. They're causing ice melting at an enormous rate, for example. And so part of the logic for Pennsylvania forgiving itself for going to gas is, well, it's not coal. It's better than coal. Gas is a carbon technology. So you'd say to yourself, well, let's design and develop. We're in this pickle. Let's get a safer ameliorating technology. You're not going to get it by turning to gas. That's all you can do to the needle. Natural gas and shale oil also effectively due south. And I'm not even convinced that natural gas is less harmful than coal, but that's the current wisdom in the city. What you actually have to do, and we can't, the good news is we can do this. There's no question we can do it. We have these technologies, solar thermal, wind, PV, geothermal, and a few others. And over time, we have to move that needle to the north. And you do it by if we don't have another discovery, we can do it. You do it by systematically moving the quantity of energy that you're getting from the southern technologies to the northern technologies. There's also another side where you erode toxicity. Technologies can be toxic or ecotoxic. Coal is extraordinarily toxic. You can't now eat tuna without getting a heavy dose of mercury. The mercury is coming from burning of coal, which is filling the atmosphere and raining into the oceans and bioaccumulating up the food chain. That's an extraordinary thing. Our fish life is becoming heavily intoxicated. Depends on where farm fish come. Some of our farm fish, depending on what they're feeding it, if they're feeding it fish high in the food chain from the oceans, it's incredibly toxic. And so again, they're all basically very toxic technologies. There's no escaping that. These ones, comparatively speaking, are not, and what we have to do is systematically move that needle to the north. Now there's another needle which integrates the two, the big needle, and that's the one we should keep our attention on. And if we were lucky enough to have an energy portfolio that put the needles there, it would look like that. It would lie exactly on the purple needle if the orange one pointed due north. It'll be it's a little bit worse because the orange one was also contributing to unsustainability. If this was the worst side, it would lie over there. Well, it doesn't look like that. It looks like this. Our energy sector is effectively pointing due south. And we either decide to do nothing about it, the current pattern, and we're hardly doing anything about it, and leave it to the kids and the grandkids who will be dramatically less able to handle it than we are, or we get to work on it. Nuclear has a different, totally unsustainable compass profile. So when you look at this, you say, well, how do you solve a problem like this? This is a big problem. How do you deal with it? And first of all, you have to look and see what are its components. So how much does our inability to move to renewables arrive from technical? We've got them. They're on the shelf. It's not technical, cultural or political. It's cultural and political forces that are keeping us locked into unsustainable energy. And so you can see this if we do the compass a little bit more simply. And I think I can capture here what I believe is going on. So here's a guy. He's tough. He's big. He's got lots of money. In Pennsylvania, he's gas and he's coal. And here's another guy. He's not so tough, but he's pushing up on that needle, and this guy's pulling up on the tail. And we need the guy on the right to win. We need the renewables guy to win. So what do we have to do? What are the components of making, he can afford immense power. He's basically bought our State House. He's bought much of Washington, D.C. He's all over the world, sprinkling money all around. And he buys compliance locally by giving people money for their mineral rights. There's no stopping him, apparently. We need that guy to win. He's the only good future for our children. Well, this is a marketplace competition for sure, and the argument used to be that solar is completely unrealistic economically. That is not true. We're close now. We have seen falling solar photovoltaic costs for a long period. If we'd been working on it, it would have come down much faster. But we can see in the not too distant future when photovoltaic energy is going to be cheaper than coal. It's scientific engagement. The great thing about the renewables is with science, they only get better. They only get better. You can't fix the carbon technologies. You can pretend, but you can't truly fix them. It's a political tournament where money is so incredibly significant. And it's a public opinion contest. And this is where we're going to have to win it, which is why meetings like this are so important. Never forget, he's got the power. He's bought the power. But he does not have to cost account the injuries to the future that he's inflicting on it. He's getting his money for free without all those horrible penalties which are going to be visited on our children and grandchildren. So with energy, most money steering America and the world down deadly unsustainable paths. Good sense, goodness itself, and the future good are all trapped by this dynamic. This is the dynamic we have to change. Now, there is a judge, and the judge is Mother Nature. And you can't negotiate with Mother Nature. Mother Nature is a positional negotiator. That means Mother Nature comes into the room and sits down and says, here's my position, live with it. I'm not moving. You do that, I'll respond that way. You keep putting CO2 into the atmosphere, I'll melt all the ice. There is doesn't care about the stock market, doesn't care about the bank accounts of the Koch brothers or T. Boone Pickens and others, just doesn't care. So what is sustainable development, again in the big picture? And it's significant to turn to a wonderful document, really the highlight document of sustainability in a global agreement sort of way, the Brundtland Commission's Our Common Future, where the opening sentence is, sustainable development is development that meets the needs of the present without compromising the ability of future generations to meet their own needs. Now, you can count on people to meet their needs. Don't worry about it. We're going to meet our needs. That's what we do. We're all very good at that, right? The interesting twist is the yellow part. Without compromising the ability of future generations to meet their own needs. This is totally novel. We've never had to do this before because we haven't had the power that we have now, as we will see. That's a great report. You can read it on the internet. It goes on to say it contains within it two key concepts. The first, the concept of needs, in particular the essential needs of the world's poor, to which overriding priority should be given. Now that's a hard one for a lot of people to swallow because they're busily thinking about their families and how do they get through life. But the truth of the matter is with sustainability, if you're not thinking about the world's poor, you're not going to get there. I'm sure of that. The second thing is the idea of limitations imposed by the state of technology and social organization on the environment's ability to meet present and future needs. Basically, they saw, that's another way of saying the compass with the two gentlemen that I just showed you. They saw the cultural and technological limitations of things. So sustainability now challenges us all to meet really Herculean technical and social challenges implicit in this word that's omnipresent. You're hearing it everywhere. It isn't going away. It is the big word. It is the big challenge for this century. A little bit of history. We've had the oil industry for 150 years. There's Edwin Drake. He discovered oil in Titusville, Pennsylvania on the August 27th or 28th of 1859. They don't know the date because when they went home in the evening there was no oil in the hole, and when they came back in the morning there was oil in the hole. They weren't sure when it started showing up. That was his original drilling system, and it was very able to be mimicked. And so in this was an equivalent rush to the 1849 gold rush of California. That's where it began, right here, 100 miles north of Pittsburgh. It's 150 years old. Now, we surely had coal, and we were using a lot of coal by 1859. But this very movable, very high density, very usable energy source changed the world, quite literally. And one of the manifestations of what it's done is that. And at least if the cars are going to remain the kind of cars that we have to say, that picture is completely incompatible with sustainability. Let's look to the canaries in the coal mines. This is the Kiribati Islands in the Pacific. There's about 100,000 people there. It's a big piece of the Pacific. That's the capital, South Tarawa. My headmaster when I was in high school is still around teaching, and he's teaching in the Kiribati Islands. And my friends who've had conversations with him tell him, hey, we're not just losing the island from the side, We're losing it because the water table's rising and your backyards are going underwater. This is poor little Tuvalu, another big piece of there are only 10,000 people there. The Tuvaluans are all heading to where I come from in New Zealand, because quite literally their land is disappearing under them. And so this is what we're doing. You know, before gas, natural gas, Pennsylvania, 12.5 million people, was producing more than 1% of the global CO2 because of our big coal base. Where is it going to go as we develop this? Goodness knows. But I did a quick calculation, and if we turn all the projected amount of gas that's down there into CO2, it's 3 parts per million. 3 parts per million to the atmosphere of CO2 is huge. If everybody was doing it, we'd be there next year to the 450 drop deadline. It's huge. Really, again, another way of looking at this was an idea I got from Rachel Carson. There are two alternative energy-driven realities for our civilization, for our species. Quoting from Dr. Carson, we stand now, from Ms. Carson, we stand now where two roads diverge. But unlike the roads in Robert Frost's familiar poem, they are not equally fair. The road we have been long travelling is deceptively easy, a smooth superhighway on which we progress with great speed, but at its end lies disaster. The other fork of the road, the one less travelled by, offers our only chance to reach a destination that assures the preservation of the earth. That is so epically true today. And of course, a chance isn't a chance that happens in a day, this happens over decades. And so there's this beautiful blue planet, the only place in the universe we know where life exists. And if we follow the road most followed, the one we're on right now, we're ending up in a very bad place. The unfortunate truth of the matter is it is a superhighway. It's the carbon dioxide highway. And you can drive down that highway in a limousine, certainly if you're wealthy, and the wealthy people make these decisions. You can turn up the air conditioning so if it's getting hotter, it doesn't matter. You can have dark windows so you can't see the trouble outside the windows, and you can be very comfy. But this is where you're headed. You're headed to a dramatically reduced and diminished Earth. And we keep running the stop signs. There are a number of times in our recent history where we've had a chance to change direction, and we have not. We've run the stop signs. We must stop at one of these stop signs. The other pathway looks like this. Renewable energy technology. The problem with it is, of course, is that it wasn't a comfy ride economically back in, say, 1980, when we veered very much down the lower road. But what's happened is it got easier and easier, and I think we're basically at the point where the super fast snazzy car is coming in to make it real easy to go in that direction if we'll just do it and demand that everybody else in our civilization does it as well, or help everybody to do it. Coming back to the point about the poor, the world's poor always seem to be the most vulnerable to health and the environmental impacts of unsustainable products and processes. And if you're not worried about them, you're in terrible trouble. Let's see why I can state that with surety. So what does a Bangladesh going underwater mean to you? What does a disappearing Bangladesh mean? Well, let's think about it. There it is, if you didn't know where it is, at the top of the Bay of Bengal. We'll also talk about the Maldives down here at the bottom in a minute. And good question with geography is, how big is it? Well, it's 50,000 square miles, more or less. It's 5 to 10% bigger, 10% bigger than Pennsylvania. It lies between New York and Iowa in state size, 55,000 and about 48,000. There's 145 million people there. Almost one person for every 2 Americans crammed into Pennsylvania. That's its topography. most of the country, and there's the line of the country, it's not all of this, most of that country is a few feet above water. All of it nearly is below the 12-metre mark. And this is their capital, Dhaka, which regularly goes like this and much worse than this. And it's happening with much greater frequency. And it turns out, because of what we're doing with carbon, we're filling the oceans, as I said before. The rate at the present is about 1.3 to 1.4 inches per decade. Now you may say, oh, well, that's not a lot, is it? It turns out if you're Bangladesh, that's an unbelievable amount. If you're the Maldives, and now we're not talking about little Pacific islands with hardly anybody, there's 365,000 people here. That's one of the most densely populated pieces of territory in the world, Mali, the capital. You're disappearing in real time. That is never more than 7.5 feet above water. And as I said, you can actually see the movies on the internet of it disappearing. And these are the huge floods of last year in Thailand, and on it goes. So what does this all mean for justice? It's being led from America, frankly. Other countries have followed, but it's being led from America. What does it mean for American leadership then? What does it mean for the world economy? Because I tell you what, you drown a Bangladesh and that'll have an enormous impact on the economy. What does it mean for human welfare everywhere and out into the future? The fact that you can't trust your fellow human beings not to pull the land out from underneath you. What is the value of it not happening? I doubt the money being made in Pennsylvania from gas fracking could have the slightest impact on the tragedy that's unfolding before us. Many energy and chemical companies are heading precipitously in the directions that seem to ensure that much of Bangladesh will be submerged. Massive gas fracking, for example, with the energy and chemical companies. Now, it's not just countries that are culturally different from us. It turns out the oceans are not flat, the surface of the ocean. There are mountains and there are valleys. And Greenland is at the apex of an ocean mountain. And the reason it is so is because all that ice on top of Greenland has enormous gravity. So it sort of sucks the ocean up to it. And so if you melt the ice, even after you put the immense amount of water into the ocean and nothing else happens, the coastline at Greenland will drop 100 metres. Now it's thought that Greenland will bounce back up, presumably with lots of earthquakes involved in that, and it'll only be 25 metres. But that ocean mountain dissipates over 2,000 kilometres. And Europe and parts of North America are in its protection zone. And so when it goes, and it could go autocatalystically, like things go like that, and then whoop, it takes off, there is no Holland, there is no Denmark, large parts of England are underwater, large parts of France, and on it goes. We're already experiencing in North Carolina rising ocean, visibly experiencing it. All right, so sustainability, dealing with this problems, requires you think across disciplines. Karl-Henrik Robert will very accurately tell you one of the biggest problems is we're all stuck down in our specialised drill holes, and we don't know what else is going on in the world. Universities have to change that. It's a really big change. To be a great scientist, you really do have to go down in a drill hole, but we cannot lose everything else in the process of doing that. How can we have a sustainable world without industry, governments, non-profits and academia in Asia, Europe, basically everywhere? You can see the magnitude of this problem. It looks enormous, but it's doable, right? Because I firmly believe the answer to E.O. Wilson's question, are we better than bacteria in a petri dish, is yes, we are, because we've got this. And if we don't use it in this context, we're worse than bacteria in a petri dish, Because bacteria in a petri dish don't know until they experience it that they're eating all their nutrients and dying in their own mess. Now, every country has a special role to play in this. If we're going to address it, every country has its thing to do. And for the United States, it's about capitalism. The major US, they're all capitalism challenges. The tough guy and the other guy. That's the central theme. It's unthinkable that we're going to fix them if we don't address the cultural problems. Unthinkable. We just won't do it. And so you think, well, what can we turn to try to find tools to deal with this? What's wrong with us that we're having so much trouble? And I think the person who most accurately got that is Hans Jonas, and this is about ethics. Now, the field of ethics involves systematizing, defending, and recommending concepts of right and wrong behavior. This is about right and wrong. Sustainability ethics is about right and wrong behavior with respect to sustainability, and we should not be afraid of those terms. We need not to be afraid of them to succeed. And this great book opens in the following way. All previous ethics have been based on the premise that the human condition, determined by the nature of man and the nature of things, was given once for all. For Christians, God came down and gave Moses the Ten Commandments. They were supposed to work for Moses' people immediately. They were supposed to work for the Jews and Romans in the year 0, in 1000 BC, in 2000, and out to 100. They're supposed to work forever. But think about them. The first 3 deal with, if you're a Catholic anyway, deal with your relationship with God. The remaining 7 deal with people that you meet. You're not going to meet the people in the future. You're not going to meet them. Yet you have this extraordinary responsibility to them. All of the information's in the Bible, but it will take some interpretation. I think we're going to need the help from religion to get there as well. And the human good on that basis was readily determinable. You follow those rules and everything will work. And that the range of human action and therefore responsibility was narrowly circumscribed. The Ten Commandments and our basic ethical principles have very narrow reach in time and space. But we're talking about reaching out forever and making decisions about what we do because of our power. But with certain developments of our powers, read science and technology, the nature of human action has changed and given rise to a whole new dimension of ethical relevance for which there's no precedent in the standards and canons of traditional ethics. Our species is in a completely different place to where it's ever been before because of science and technology. And what we need to do is worry about this and think about how to fix it. The key thing is transgenerational justice. We have to move that to the center stage of our civilization. We have to think about future humans. Now, is there a way to handle this? Is there using the directional thing, is there an escape route to a better future? And let's face it, all the things that we're doing right now are not working, or at least they're not working well enough. They really are not. Now, there are some countries like Denmark, which is getting a huge amount of its energy from wind, and Germany, wonderful, huge amount of its energy from wind and solar. Germany has the same photon density as Pittsburgh, by the way, for the most part. So it can be done. We know that. So you have to think about the process here. And we're talking about splitting resources between the present and the future. So here's the present walking onto the stage and sitting down. Who's going to sit at the table? Well, it's a phantom. The phantom doesn't exist yet. The future person. So that person has to be defended by existing people who are defending sustainability, both men and women. Gary Cohen is definitely a person standing behind that kid. Dr. Noe is also such a person. Phil Johnson, who'll speak later, is such a person. These are, if we do this and do it properly, there will be a good future. If we don't, there will not. And so, how do we do it? And as I think about this, when humanity's got into terribly tough positions in the future where something really important just isn't working, they've had groups of knights have come along and focused on that problem. And I mean this sort of in a creative, fun sort of way. But there's something, as you'll see very shortly, that's very important about it. So in the past, when society's been threatened with doom, a saving redirection has sometimes come from an order of knights embodying a transformational vision. And I wonder, do we need sustainability knights? Of course, today it would definitely be both men and women, and we can probably count on the women to be the heavy lifters. Well, if you look at various kinds of knights in the past, one that I kind of like are the Teutonic Knights. They started in Jerusalem at the beginning of the 10th century, and their job was to protect pilgrims coming from Haifa, the port, to Jerusalem, because the road was incredibly dangerous, and they also set up hospitals and ran hospitals. They were called the Knights Hospitaller as a result of that. But they became incredibly powerful. And they eventually had their own state in East Prussia. It's now in Poland, and they built this castle, which is the biggest castle in the world, biggest ever built, and to this day is the biggest brick building in Europe. But they got too powerful. And a very similar story comes from the Knights Templar, which trace down today to the Freemasons. They also got their start at the beginning of the 10th century, and King Baldwin, who was the Christian king of Jerusalem at the time, said, okay, you're an order, and you can live there. That's the Al-Aqsa Mosque, not the big one with the gold dome on the Temple Mount, the one off to the side with the silver dome, which is oxidized. And that's the third holiest place in Sunni Islam. So you can imagine having Christian monks parking in, or having some other religion setting up house in Notre Dame de Paris. That's the equivalent of what we're talking about here. But their job was also to protect pilgrims. Now, could such an order catalyse a worldwide sustainability conversion today? We're being playful. For now, just put aside the question of what will work to best in today's world, whether it be this inspired group of knights or teachers following a new educational paradigm, a virtual commonwealth of global citizens or something else. Put that aside to ask the critical question. Put first things first, as Stephen Covey would say, and ask what collection of ideas could endow knights or some modern alternative to rescue civilization by teaching us how to treasure the future good. What would be the code of chivalry for these knights? An imaginary order called the Sustainability Knights. Well, here's the first thing. You would dedicate your life to learning and pursuing what sustainability requires. That would be a middle-aged picture of somebody doing such dedication, scholar. It would look like that today. Doable. Promote peace and harmony through fidelity to the welfare of the future. This statue is at Nagasaki. Seek nothing above the honour and respect of future generations. When President Obama is doing this, he's going to be honoured by future generations. When he's making the mistake, as somebody put him up to a few years ago, of calling nuclear energy green energy, he's making a big mistake and he won't be honoured for it. You've got to get these things right. Build strength through devotion to your career and use it to secure the wonders of life. The universities have a central role to play in sustainability. And to do it, we've got to reinvent the university. These ideas of sustainability have to pull us out of our drill holes and get us to working together on these problems. Teach that sustainability is not an endpoint, but a direction that can be logically identified and realistically pursued by everyone. Uphold and protect the environment and everything needed to sustain us. I love this picture. You can see the love of presumably the grandfather for the kid. And the kid is watering the flowers. It's a beautiful picture. We need to be teaching our children about nature. Champion biodiversity. These are all the places on the planet where we have biodiversity hotspots, where enormous amounts of life are disappearing really quickly, and I'm embarrassed to say that New Zealand's right in the middle of one of them. Teach that a money first in all things civilization will perish from the earth. If it's about the money going to the Koch brothers and T. Boone Pickens, and I'm deliberately picking on them because I think what they're doing is dreadful. If that's what it's about, we don't have a chance. Work to make jobs and wealth and sustainability mutually reinforcing. We have to have an economy, but the economy has to work for sustainability. Challenge those who refuse to be constrained by sustainability imperatives. Now, you may not know about this picture, but this is the New Zealand All Blacks doing the haka before the team that they're about to play, and that's a challenge. By the way, in a sustainable world, in my version of a sustainable world, the All Blacks rule in football, in rugby. Resist those who exploit human vulnerability by setting present-day survival above sustainability. Now, this is in West Virginia. This is a mountaintop mining, and they just let off a big explosion. And what the moneyed people of the coal industry are doing is they are turning West Virginia communities against themselves. They're saying, these guys who are arguing to clean up your act are going to cost you your jobs. They're dividing and conquering. It's the worst kind of social engineering. It's horrible. But it's going on, and it's going on right now. And in the meantime, we got black lung under control by about 1990 with all sorts of heavy-handed regulatory stuff. Black lung is taking off like a disease is taking off like a rocket again. And young miners, young coal miners now are being impacted by black lung disease. Never devalue sustainability for money or political support. It is so easy to approach a sustainability problem and say, well, I'll talk about this part of it, and somebody will give me some money. But if I talk about that part of it, then they're going to get mad and take the money away. That dynamic's always in play. So with energy, let's talk about natural gas and say it's not coal. Not let's talk about natural gas and say it's a CO2 producer, etc. You can't do that. If you're going to be a knight in this order, you have to have very high standards. And there's a problem because most of the bad technologies have most of the money, as I said before. Always resist those who would distort the science of sustainability for economic or personal gain. So we just finally got a dioxin reference dose from the EPA for non-cancer endpoints. They couldn't allow cancer endpoints. The non-cancer ones, fortunately, are the important ones. The reference dose is the amount that you can be exposed to and be safe. The number's so low, we don't have a prayer of getting to it. Yet Dow is continuing to expand chlorine production. We're going to have ethane crackers here in Pittsburgh soon. Then we'll have the ethylene, and there won't be very much time before we have the vinyl chloride production plant. When you burn PVC, and it's being burned all over the world, you make dioxins. Dioxins are unbelievably potent developmental disruptors. PVC's got to go in a sustainable world. Never resort to physical violence for any reason. The issues that we're dealing with here are so powerful that the kind of things where people can get so upset that they can get physically violent. We lose. Sustainability loses if that happens. So these sustainability nights are not carrying swords. Never break faith for any reason. This is Buffy, and Buffy never breaks faith. And finally, welcome all who honour this code as sustainability nights. That picture is called the first man and woman. Welcome everyone who will honour these as sustainability nights. Well, it's a thought experiment. It might work. We perhaps do need extremely powerful group of people totally focused on this problem to lead everybody else out of the morass. Now, there's a webinar on July 26th there's a really neat company, and they're putting up the largest solar plant in Pennsylvania in Lancaster County. And you can join the webinar on July 26, 11 a.m. And if they're offering coursework to professors, etc. This is a great thing. My group's going to sit and watch it. So I just wished, instead of fracking, we had this going on all over the state, because we'd have the problem nearly solved if in the last decade we'd been doing that. Well, I've had a lot of people support what I've done over the years, particularly the Heinz Endowments has been exceptionally generous to us and given me a lot of freedom to say things that offend people. And this is Pittsburgh. I show it in every talk I give. It's on a cloudy day, but it's a great panoramic view of the city. And you know, we have truly great people here. Obviously, it's the home of Rachel Carson and Teresa Heinz. Thank you. Thank you.
Does anybody have, we have a little bit of time for questions. And we'll also have questions and discussion at the end. But does anybody have a question right now for Dr. Collins? Yes.
My father is a physicist, and he presented me a quantum. He said, if you were transported to the past, how would you convince someone you're from the future? And I feel the same adage applies here. How do you convince people that this really is, that everyone needs to focus on this problem, and that we can't always work in our own self-interest? How do you get people out of work?
So I mean, it's the question, and in a way I've tried to answer it here. I think that, well, first of all, you talk about the problems. Talks like the lectures like this and what we're going to have following it, we need to be having everywhere around the world with in large numbers. You persuade people. You find critical data and put it up here. That's your sword in the night thing. The data about what's happening to the planet, and and people get in a tussle with you, and you have that data. Let me tell you, you will win instantly those tussles. And so the more of us that are prepared to speak out on these problems and take them on in all their toughness, and particularly address the crippling money issue, the more chance that we have. And so I think your father's exactly right. I think that question should be right on the center of the round table at the first meeting of the Sustainability Nights. Yes?
One of the arguments for the wind tunnels in western Pennsylvania has been that they are killing birds.
Yeah.
And that I did a review that one leak from a nuclear power plant is far more deadly and toxic. Then they reviewed to me that the birds are eating the insects and then the ecosystem harm within there. Do you know of any additional studies or anything that has shown that?
Well, no, I don't. But you know what? I think that's a fantasy statement that somebody threw out.
No, it's not. There's been studies on it. It's not a study, and as a result, the construction of them has slowed in this area.
So there are piles of birds under windmills. So the problem is I've been underneath windmills and I didn't see any dead birds or bats for that matter. So how bad can this... I mean, the way they're talking, you'd expect to walk up a windmill and the pile of dead birds would be building up and maybe reach the blade so the windmill couldn't turn anymore. Yeah. Well, I'm sorry. I do experiments. I mean, I have just never seen any dead birds under a windmill. And if there's a few there, that's a tragedy. But we're talking about, I think, a totally overstated problem.
But since Marcus Shaw has come, the wind tunnels here in Western Pennsylvania, they have ceased to be, more of them ceased to be constructed.
Right. Well, we need to see the data. And, you know, for every case, I'm sure I can go and take a lot of pictures of windmills with absolutely, they've been working for years with absolutely no dead birds under them. Yeah.
May I ask quickly?
The nights of the sustainability order. And I was thinking about that a couple of years ago. There was a logo that says climate hawk. And somehow the movement needs to have some sort of a focus like that. I don't know how to get people to recognize that this is.
Well, I'm thinking of producing an op-ed on it just to see what happens. But you know, people look knights in the 21st century. Come on, people will have that. But I think.
What do you think about? What do you think about what we can do individually? Like right now, actually, we can do a lot individually. Like we can buy an electric car. We can sign up. Now you can sign up for your electricity provider to choose wind-generated energy as your source. You can do that. We can all do that right now today. And so more and more people do that just on your own. Never mind convincing anybody else. You can actually do those things yourself right now.
Right. I totally agree. Carnegie Mellon was the first university to buy heavily into wind energy, and it's number 2 right now in total. This relatively small university has the second highest renewable energy in absolute energy units. Quite remarkable. And a tribute to Jerry Cohen and Mark Kamlet. Thank you very much.
Okay, thank you. Well, I really want to thank Dr. Collins for presenting an enlightening and thought-provoking and really inspiring presentation on the problem of climate change. And now we'd like to welcome Gary Cohen to the stage. He is the founder and president of Healthcare Without Harm, which is an organization that supports healthcare professionals and healthcare facilities towards meeting their sustainability goals and really encourages these facilities to set sustainability goals. And Gary is going to talk a little bit about what is healthcare's role in this problem of climate change and how we can move towards more sustainable practices. So, yes. Yeah, we really talked about that at the beginning. We moved it a number of places. Is it the table or the chairs? It's the table too?
Okay, we
so
can
we
do
should
all
move it
that.
all back.
Hold on.
Yeah. Thank you. And my other question is, can everybody in the back hear when somebody asks a question? Can you hear all right? Okay. I just wanted to be sure. Okay. Thank you.
Thanks.
Welcome.
Hi. Well, there was a long time where I used to think I wanted to be a doctor, but now I decided I want to be a knight. Because clearly that's much more interesting than being a doctor. And you get to wear a cape, too, which is really fabulous. So I'm really happy to be here and to follow Dr. Collins. We didn't actually share our PowerPoints before we spoke, but before we came today, but it actually feeds really well into each other. So I'm going to take on where Dr. Collins left off and talk about the health implications and in particular the role of healthcare, the intersection between healthcare and climate change. First, a word about Healthcare Without Harm. We have been around for 16 years. We're a nonprofit organization. And our job is, and mission is to do the following things. One is to bring an educational framework to the healthcare sector to understand the links between the environment and people's health. There are a lot of nurses in the room. There's physicians. People don't get educated in the healthcare profession about the links between environment and health. And yet the science is telling us more and more that the reason that people are having an epidemic of obesity and diabetes and asthma and learning disabilities and cancer is because the environmental health conditions in which they live and work. And yet the profession that's devoted to healing isn't educated around those environmental links. So we see ourselves as making that connection. Second, and it gets to the ethical point that Terry was making, it's about evolving the Hippocratic Oath. So this is the one part of the economy that actually lives within an ethical framework. I mean, universities you could say also, but that somehow gets fuzzy. but in particular, the healthcare sector is all about doing no harm. So what does the idea of first do no harm mean in a society where children are being born with 100 toxic chemicals in their bodies already? What does first do no harm mean in the kind of climate-stressed planet that Terry was talking about a few moments ago? What's the responsibility of the healthcare sector for addressing its own environmental footprint, cleaning up its own house? Third is our idea is that because the healthcare sector is so huge, in this country it's 18% of the entire economy, and because of healthcare reform it's going up to 25%. The only thing that's bigger is the military. So as a driver for sustainability, for a low-carbon, toxic-free society, healthcare is absolutely central to that transformation. And then fourth is, once you get healthcare to clean up its own act, its own house, we need health professionals, we need nurses, we need doctors, we need CEOs of healthcare, we need companies that are in healthcare to be messengers for the largest societal transformation that's necessary. So if you can go up against the moneyed interests of the fossil fuel industry, and you have nurses and physicians and leaders in healthcare speaking about about why we need to make this transformation, that begins to tilt the equation politically. Every year, the Gallup poll does a survey about who is the most trusted profession and messengers in America. It's nurses. Every year, nurses are the most trusted messengers in our society. How many nurses are in the audience? See, we love that. Yeah. And then finally, ultimately, we can't build a healthcare economy that's built on just treating sick people. It's not a healthcare system, it's a disease management system. So now you have 1 in 2 men are going to get cancer. 1 in 3 women are going to get cancer. 1 in 6 kids have learning disabilities. The obesity rate is supposed to go up to maybe 40% of the entire population by 2025. You can't, all those numbers, that damage is going to bankrupt the healthcare system. Because we've created a system that is pulling people out of the river once they've been thrown in and saying, how can we help you? How can we treat your cancer? How can we treat your obesity-related disease? We've got to go upstream and figure out why people are being thrown in the first place and prevent that. So that's what Healthcare Without Harm is about. So now let's get to this issue. So I think one of the problems that relates to why we've not addressed this issue in the way that it requires, given the urgency, is the way that climate change has been framed. And this was a very powerful image in Time magazine where they sort of acknowledged this is really happening. But look at the image. It's a polar bear on a melting ice cap. The issue was seen as environmental. And, that's great if you're a member of the Sierra Club or a World Wildlife Fund, but it's far away. It's far away. It's ice caps. And to the extent that it's been framed, it's been, okay, so we want to get off, Middle East oil because of, Iraq, Iran, all the uncertainties. So if we go to fracking in Pennsylvania, does that really solve the problem? And then it's also been framed as a green jobs development thing, but we haven't quite moved yet fully to that. So people didn't buy it. People didn't buy it. It didn't connect with people. There was more foundation money put into trying to pass the cap and trade legislation in Washington than any environmental initiative in history. And yet it didn't succeed, and in fact we moved backwards. Because now you can't even say climate change in many political quarters because they don't believe it. The fact is that climate change is going to be the biggest global health disaster of the 21st century. The way that people will learn about climate change, that people will experience it, is in their lives, in their homes, in their communities. This was a quote from the Lancet, which is sort of the American journal of, it's the top medical journal in England. And even beyond what Terry was saying in terms of a transactional justice issue, transformational justice for the future, it's being felt today. People will experience climate change and the impacts of uncertain weather and this lifetime, not in the future, this lifetime. So what are some of those health impacts of climate change? One is massively increased asthma rates because of low-level ozone, CO2 emissions. Two is the spread of infectious disease. This winter, in February, was the first time that they reported cases of dengue fever in Miami Beach. 25 years ago, dengue fever was in Panama. Now it's in Miami Beach. 25 years ago, malaria in India was at 3,000-foot elevation. Now, because of warming and the allowing mosquitoes to go to a higher altitude, malaria is at 7,000 feet elevation. This affects 100 million more people to potentially get malaria. Heat stress, I'll talk about in a minute. Food insecurity, waterborne images, the images of the flooding that Terry showed in Bangladesh and these other places, that contributes to the spread of cholera and other diseases. So people will experience it, and they are today, health impacts related to climate change. Here's an interesting slide. The two colors to pay attention to are the blue and the orange or red. So what this is it's showing the extreme heat days in a year in 5 California cities. And the blue is where they were up to 1990. So take Los Angeles, there were maybe 18 extreme heat days, over 100 degrees, with high humidity. The acceleration of extreme heat days under different climate change scenarios is where you get to the orange and red. So even the orange, which is now becoming a very conservative estimate of how much warming there's going to be, this would mean that, hold on, let me get this out of here, that places like Fresno and Riverside and Sacramento are going to have 70 or 80 days per year of extreme heat. And if it goes in the way that it's looking like, we're not turning this around, it could be 100 days a year of extreme heat. Now, what does that look like? What does that translate to? What does it mean to have 100 days or 80 days of extreme heat? Okay, so let's take a small case study. California, 2006. There were 14 days, right? Only 14 days of extreme weather, 100 degrees. There were record nighttime highs. In that 2-week period, 1 million people were out without electricity. 1 million people. Just last weekend in Washington, D.C., it was more than 1 million people. This is happening today. The death toll was 150 to 450 people. There were 16,000 excess emergency room visits and 1,000 excess hospitalizations. This is 14 days. It overwhelmed the healthcare system. And in terms of economic loss, 25,000 cattle and 700,000 chickens died. So that's 14 days. Think about what it's going to be like if there are 50 days in which the heat is that high. We also understand that as the climate gets warmer, that there's more virulent forms of poison ivy, there's stronger ragweed mold and other molds, and in fact it will increase asthma and other respiratory problems. And if we link again the amount of asthma that's in the communities around the country and the cost of what that is to treat, it's a massive number. And those numbers are not in the bottom line of the oil industry or the fracking industry. Those are externalized. And where are they externalized? They're externalized onto us, our health insurance rates, the hospitals that we have to rush toward, all of that. So one of the things that's not been described a lot when we talk about Hurricane Katrina is what did we learn about the resilience of the healthcare sector? One of the things we learned is that vulnerable populations are most at risk. People in low-lying areas, people that can't get away, people that have no resources were hit very, very hard. And the institutions in New Orleans were completely unequipped to deal with the health impacts. So this is a picture of Memorial Hospital and St. Rita's nursing home. So Memorial Hospital was built like many hospitals. All the electrical equipment was in the first floor. None of the rooms had operable windows. So within the first few hours of Hurricane Katrina, the first floor of the hospital was flooded. So therefore no electricity, none. Therefore no elevators, no equipment that's running. Imagine your hospitals with none of these things. And then because it was so hot, the temperature in the patient rooms on the top floors got to 120 degrees. So they had to give the doctors and nurses and environmental staff hammers to break the windows so that people could breathe. And then they had to cart patients down from the top floors by hand, down the stairs. 50 people died in Memorial Hospital during Hurricane Katrina. So we haven't really started to internalize what does it mean to go through this level of crisis, and what is the response of the healthcare sector in actually being prepared for this and mitigating against this. So part of what we've done is to try to say the healthcare sector has got to play a critical role. For one, it is the second most intensive energy commercial building sector after food service. Second, they are the ones that have a mission-related interest to reduce their climate impact, because the reliance on fossil fuels in healthcare is actually contributing to disease. And it goes against the mission to do no harm. And the third reason, which is a very strong motivation for healthcare today and most industries, is that it saves millions and millions of dollars. If you reduce your energy reliance on fossil fuels, if you become more energy efficient, if you move toward renewables, you're going to save millions and millions of dollars. So we've created a lot of different tools for hospitals to move toward renewable energy, to move toward energy efficiency. And there's a broad set of opportunities to do that, not just in the energy sector, but in a broad set of things, including food. So if you move away, if you reduce the amount of meat you serve in a school, in a hospital by 20%, and buy more sustainable fruits and vegetables and serve that instead, there's a massive climate positive impact. Just that. We've helped design a new way of thinking about how to build hospitals. So we've sort of challenged the healthcare sector. And this could be true of affordable housing, too, and among a number of building sectors. Can we build cancer centers without carcinogens? Can we build pediatric hospitals without chemicals linked to asthma or birth defects? Can we have hospitals with fresh air, with healthy food, with sunlight? And so we created this framework called the Green Guide for Healthcare, which embeds environmental health into the building design, which includes energy efficiency and all these other things. And it's been taken off all around the country and around the world, and now it was incorporated into the new Lead for Healthcare that the U.S. Green Building Council has passed. And it's been adopted by the Australia Green Building Council and others around the world. But it's about rethinking the hospital so that it's not some gleaming tower of disease, but it's an embodiment of what resiliency and sustainability means. As a moral issue and as a religious issue, interestingly, Catholic healthcare and the U.S. Catholic Conference has really understood that it's really about the poor. And they say, as Catholic healthcare providers, climate change is a moral concern, and our faith demands prudent action to reduce our climate footprint, protect human life and dignity, and raise our voice on behalf of creation and the poor. In this country, there are 600 Catholic hospitals serving 100 million Americans. So in terms of creating a broad movement, a sea change in the way that we think about these issues, and linking it to our sort of deep religious values, this is 100 million Americans, and we're seeing the same kind of awareness happening in the Protestant community, in the Jewish community, in the Islamic community. There are some very positive examples. There are some knights around the world that are working on this. We've worked closely with Kaiser Permanente. It's the largest nonprofit healthcare system in the country. And they have developed a long-term strategy to move toward clean and renewable energy. They've been supporting wind power. They just put in some of the largest amounts of on-site solar of any healthcare facilities in the United States. They've invested simple things in new lighting and window film installations. They spent $2.4 million, but they're going to save $1 million a year. And what's interesting about their approach is, in addition to all the co-benefits, they frame it. This is important. They frame it. These measures will improve the overall health of our communities and reduce our operating costs at the same time. So it's saying that hospitals and healthcare has an interest in supporting the health of the community. That means moving toward prevention. It's a preventative strategy to move toward solar and wind energy for healthcare. We need all the hospitals in the country and around the world to do the same thing. We've been working to also to move the banks in the right direction. So part of all the financing for the fracking, for the nuclear, and for the oil and industry has been support from the banks. Bank of America, Citibank, all the other big banks. If we want to really have a renewable energy future, we need to move the banks away from investing in destructive technologies to investing in renewable energy technologies. So we developed a partnership through our membership organization, Practice Green Health, to get Citibank to start providing creative financing to hospitals so that they can move toward renewable energy technologies and energy efficiency without putting up any money up front. Because everybody's strapped for cash. So if they can agree to buy the power off of the solar panels from the roofs, Citi will offer financing to allow them to install it. It's a very, very interesting strategy. We need to move the banks toward this solution like everybody else. I also want to highlight something that's going to be talked about later by Phil Johnson, is that we need to get cities to have a really integrated strategy around how they address climate change and link it to people's health. This is the Breathe Project initiative in Pittsburgh that's taking off, and it's trying to build a comprehensive strategy to educate and activate a whole coalition of citizens and industries and businesses to address the public health implications. And this is all about connecting the dots and understanding the links between why our kids have asthma, why does Pittsburgh still have some of the worst air quality in the country. And Phil's going to talk more about that. But we need these kind of initiatives in cities all around the country. There's bright spots on the horizon in Pittsburgh as well, in addition to the fact that the Pirates are in first place. This is an amazing thing. University of Pittsburgh Medical Center has, with the leadership of Allison Robinson, who's in the audience, who's the sustainability coordinator, done an enormous amount of work around their energy footprint. They've moved around construction and sort of adopting LEED. They've done all sorts of energy retrofits and starting to do geothermal projects, reducing their electricity use, reducing their water use, doing green landscaping, creating healing gardens, moving toward drought-resistant plants, actually helping to create electric vehicle charge stations, moving away from diesel backup, although it's natural gas, okay, we'll take it for the moment, and promoting bike promotion among employees, and also, doing more teleconferencing and beginning to educate the patients about these issues and doing more telemedicine so people don't have to show up to the hospital. The hospital should be a place of last resort, not the first resort. And Judy, who was up here in the beginning, is also doing a whole bunch of work around sustainable food purchasing. This slide is around what's happening. It's a little hard to read, so I'll just explain it quickly. But this is Partners Healthcare. So this is our UPMC in Boston. Partners Healthcare is a lot of the Harvard teaching hospitals. And what they did is they did a strategic energy master plan. They said, we do get the future generation issue. We have to have an energy strategy that maps out over the next 40 or 50 years. And what do we need to do today? What kind of energy efficiency strategies do we need to do today? What's the payback for those energy efficiency strategies? When do we not start to need to put cogeneration, combined heat and power, those kind of technologies into our facilities, and what's the payback for that? And when do we absolutely need to commit to renewable energies, and what's the payback for that? So by having this is the compass. This is the compass that Terry was talking about. For having a compass for their system around a long-term plan, they can map out the kind of investments they need to make this transition. Because in order to avoid the most catastrophic impacts of climate change, we have to reduce our reliance on fossil fuels by 85% by 2050. It means we have to start today. We can't wait. We've got to do it today. And so this is a plan to do that. And now they've brought, with our help in the city of Boston, they brought all the other hospitals together in Boston to learn from Partners Healthcare, to also move down the same path together, to say, how can we all reduce our energy together? How can we learn how to do that? And there's now the CEO of Partners Healthcare in Boston is a very respected industrial leader. The healthcare sector is the largest employer in Boston. I'm sure it's one of the largest in Pittsburgh. When the CEO of the largest employer says green is good economics and Partners is pledging to reduce their greenhouse gases, it has a very big impact. You need that kind of ballast, that kind of weight to go against the interests that are being supported by the fossil fuel industry. And in Boston, there's a climate action plan now, which includes the universities, it includes the hospitality sector, it includes the real estate sector. But in healthcare, healthcare is leading the entire climate action plan in Boston, and they're framing it around their avoiding healthcare costs related to their patients. It's a very powerful argument, and this same thing could happen in Pittsburgh. The same thing could happen. UPMC and High Point, it's called High Point or Life Point, it could be the drivers for, what is it called? Highmark, sorry. I knew it was one of those things. Highmark. Could be the drivers and leaders in this Breathe initiative in Pittsburgh, and be the drivers for renewable energy, along with Carnegie Mellon, along with the University of Pittsburgh Medical Center. And so if we start to rethink the hospital, saying it's more of an anchor institution. It's one of the largest stability factors in the economy of a city. In many, many, many cities around America, there are 6,000 hospitals. And if you start to rethink it as an anchor institution for sustainability, for climate resilience, for green jobs, for healthy communities, it's a whole different way of thinking about it, which we can do, and it's already happening. Take Cleveland. So Cleveland Clinic, university hospitals, they are massive competitors, just like Highmark and UPMC. They're working together with Case Western University to aggregate their purchasing power and to say, what can we do together to support the sustainable development of Cleveland? And so with the Cleveland Foundation and others, they're supporting a solar company through their purchasing. They're supporting a green laundry. They're supporting a food hub by aggregating the purchasing power of those institutions, saying we can support sustainable agriculture in Pittsburgh. In Cleveland. We learned about this from the Vienna Hospital Association. The Vienna Hospital Association came to us in 2001 and said, we got all the hospitals in Vienna together, and we aggregated all of our food purchasing, and now we're supporting a whole band of sustainable farming around Vienna. 45% of all the food served in Vienna's hospitals is organic and local. Imagine that in Pittsburgh. That's possible. That's possible. In the Bay Area, we and Physicians for Social Responsibility, this is actually an old slide. Now there's 9 hospitals that have come together with Stanford University to collectivize their purchasing practices. And then we went to the California Alliance of Family Farms and said, hey, we got all this demand. These hospitals want to model healthy food environments. They don't want to serve Big Macs. They want to serve healthy food. They don't want to serve sugar-sweetened beverages. They want to serve healthy beverages. They don't want to have junk food in their vending machines. They want to have fast food free zones. They want to teach their patients, in order to avoid obesity, they got to eat well, and they can model that in their cafeterias, and they can model that in their facilities. And so now 750,000 pounds of produce is being sourced sustainably by these hospitals and by this university. We can do the same thing in Pittsburgh. This is an example of what it means to address the kind of damage that we saw in Hurricane Katrina. So this is the Spalding Rehab Hospital that's being built in Boston now. So instead of, and it's right on the Charlestown Navy Yard. So instead of having the mechanical and electrical equipment on the ground floor, it's now on the roof. And the ground floor and the top of the parking ramp is set higher up. The critical patient programs are above the ground floor. So in a time of flooding, you're not going to have to move patients or the kind of critical services they need. And amazingly, we're going to open the windows, operable windows, so that we can air out the buildings. And also changing the plantings and retaining walls to act as a protective reef. This is the kind of resilience strategy that we need to have in healthcare in the future. So we got it, that it's okay. So good stuff is happening in Pittsburgh, it's in Cleveland, it's in the Bay Area, it's in Boston, it's in a bunch of places. But it's not enough. It's not enough. So what we've done is to bring together some of the largest hospital systems in the country as leaders. These hospital systems represent over 500 hospitals of the 6,000 in the country. They're 9% of the entire market. We said, what if we can pull all of those together in the same way that we're talking about aggregating in the Bay Area around food? What if we could do that with all these hospitals and then recruit another 1,500 hospitals and have that, the whole sector, drive the economy toward greater sustainability? And so we created these challenge areas. One is less waste. You reduce your waste, you save money, you reduce greenhouse gas emissions, you reduce landfill. If you reduce the use of chemicals and you move towards safer chemicals, you can actually stimulate the kind of green chemistry innovations that are happening at Carnegie Mellon and move away from PVC plastics and toxic cleaners to greener cleaners. Nurses have the highest asthma rates of any profession in the United States. It has to do with the incredible amount of chemical and other environmental exposures that nurses face on the job. So for a healthcare institution, it costs $50,000 to recruit and train and keep a nurse working. And if you can internalize the cost of using those toxic chemicals on keeping nurses healthy and in work, it's an obvious no-brainer that you're going to move toward greener cleaners that also can achieve the same level of infection control. It's happening. So it also saves money. If you can move toward leaner energy, if you can move toward smarter purchasing, and you can embed sustainability into the DNA of healthcare. It's not some green, nice thing that's happening off to the side, and the really important medical care is happening in the center. In order to address the crisis we're facing, sustainability and environmental health has to be embedded into the business model of healthcare. We've addressed, and the Supreme Court has validated, that we're going to have healthcare reform. Healthcare reform is just about financing. It's about giving more people access to insurance, making sure they're covered. It doesn't address the kind of healthcare that we're going to have. And the kind of healthcare we're going to have has got to be much more toward prevention. The kind of thing that's happening at Magee-Womens Hospital, where when new mothers go home with their kids, they're getting a whole educational kit about how to protect their kids in the first year of life in terms of the toxics that might be in their home and how to switch out the food they serve. That's critical. That is a redefinition of what community benefit means for healthcare. We have to help prevent people from getting sick in the first place. So this initiative is for free for every hospital and clinic in America. And all you have to do is join, and you get access to all these free how-to guides that will walk you step by step through how do you achieve these savings and how do you achieve these benefits. It'll introduce you to other hospitals that are doing the same thing. Creates free webinars for people. We're just trying to make it as easy as possible so that every hospital and clinic in America can move down the sustainability path and find their compass. At a global scale, we've done the same thing. We've created a global green and healthy hospitals agenda as a comprehensive sustainability framework for hospitals around the world. Because the way that sustainability looks in Pittsburgh is going to be different than what it looks like in the Maldives or Bangladesh or in rural Africa. And so we just laid this framework out. So if you're about sustainability and about resilience, these are the kind of things that you want to be working on. And so we put this out. And it's been amazing, the uptake from all sorts of quarters around the world that from systems that say, we want to be part of that. We have stuff to share. We have stuff to learn. The National Health Service in the UK has joined this effort. And they're responsible for 25% of all the greenhouse gas emissions of the public sector in the UK. So they get it. Their hospital systems are contributing to disease and climate change. So they get it, and they're all about it. The Chinese Hospital Association, with thousands and thousands of hospitals, have now joined. The Australian Hospital Association, the Thai Ministry of Health, the Indonesian Hospital Association, and hospitals in every continent are saying, we want to figure out how to do this. We want to create a global learning community so that we can learn how to be resilient. Imagine that as we come into the reality of this climate stress, toxic world, the hospital or the clinic is the one place in the community where in a power outage, it is reliant on its own power. So it can keep medicines refrigerated. What about imagine that in this world that we're entering, that as floodwaters rise and the water supply gets contaminated with sewage, the hospital, the clinic, is the one reliable place in the community that has a water filtration system, right? That's the kind of system we need to create, where the healthcare center is the anchor for resilience in this environmentally stressed world. And I'll end with this thought, which is that we see that, and it gets back to ethics, that there are fundamental rights that are entering our lexicon and our world civilization in the 21st century. And one of those rights is the right to environmental health. Everybody has a right to breathe clean air. Everybody on the planet has a right to fresh drinking water. Every child on the planet has a right to be born toxic-free. Every mother on the planet has a right to breastfeed their child without the interference of toxic chemicals. These are fundamental human rights in the 21st century, and we have to work to guarantee those rights. At the moment, they're not guaranteed. At the moment, kids are being born with 100 and plus toxic chemicals in their body. Why do we think that it's such a mystery that we have such an epidemic of cancer and all these diseases in our society, when we're giving kids an incredible deficit from the moment they're born? We have to change that. Why is it that we're so surprised that asthma rates are so high in our inner cities when we're totally reliant on fossil fuels? It's not a mystery. We have to change the economy to guarantee these rights. And this intersects with this other right, which is the right to the access to health care. How can you say to the kid in inner city Pittsburgh, sorry, buddy, you can't afford, if you can't afford to get health care, we're not going to take care of you? Because his illness has nothing to do with his volition. He happens to live in Pittsburgh, or the people that live in Bangladesh, or the people that live in Houston today, or the people that live in Chicago, who are getting sick because of the environmental conditions, which are way beyond their personal control. It creates the imperative for everybody on the planet to have access to health care as a fundamental human right. And I think that if we start not just with the data, but with the fundamental values that we all share, whether we're Christians or Jews or Muslims or Buddhists or whatever deepest values we have about the sanctity of life, the preservation of creation, the rights to health, if we start from that joined place, then there's no stopping this armada of sustainability nights in transforming Pittsburgh, transforming this country, and transforming the world. We have it all within our power. Thanks very much. So, is there time for questions or?
I really want to thank Gary for that challenge to healthcare and also the roadmap, the support that he and his organization can provide to us. And we have a little time for questions now, but also we'll have them at the end. Does anybody have a question right now for Gary? Yes. Matt.
First of all, that was great. What you guys are doing is very admirable. What I would like to ask was, if hospitals are the largest employers in certain regions, has any thought been put into using that pool of local government to sort of sway the projects that are emphasized, maybe light rail or clean transportation, these sorts of things? Do you have sort of a way for hospital administrators to approach local governments?
Yeah, it's a really great question. We think that over time, that healthcare executives and professionals need to be the powerful spokespeople for policy change of all kinds around this renewable future. So I'll give you a couple examples. In California, Catholic Healthcare West and Kaiser Permanente, two of the largest healthcare systems in the country, weighed in on a policy fight that was happening in California to undo the renewable and energy efficiency standards in California that was sort of brought by Texas oil companies. And when they weighed in on the side of the public health community and environmentalists, it was very significant in tipping them and tipping the public to not undermine those regulations. In Boston, right now, we're trying to pass an energy, and at the state level, we're trying to pass an energy bill. And in the energy bill, we're trying to support combined heat and power cogeneration. And so for the hospitals, it's an enormous savings. And so now you have hospital executives going to the legislature saying, against the utility companies, saying you have to allow cogeneration because it's our path, not fracking, it's our path to a renewable energy future. And so more and more we need to do that. In a number of states, nurses in Pennsylvania, in Michigan, in Ohio, in Montana, in New York, nurses organizations have been engaged in coalitions to defend the EPA's Clean Air Act rules against representatives that want to kill it, and bringing forward the health message. So I think it's absolutely critical that healthcare professionals and healthcare executives are sort of the champions of this future. They have more stake in the game than almost anybody else. So we hope to see more of that, and we want to train those folks to be that way. We've created a climate literacy and advocacy program that says, okay, here's the science, and it's good to know the science, but here's why you got to get engaged, and here's all these opportunities for engagement. So there's a lot of room to build on that. There's a lot of examples of why that needs to happen more and more and more. Other comments, questions, critiques, apples?
Back to your comment about babies being born with toxins that are unidentifiable when they're newborn. What is the effort to work with the cosmetic industry and pharmaceuticals that mother was obviously exposed to? So there's an environmental problem there. Are there efforts in those industries?
Yeah, absolutely. Did people hear the question? so she was asking whether there's efforts in different industrial sectors to essentially detox the supply chain so that in cosmetics and other places we're not being exposed to these chemicals. And the good news is that it's happening in many, many different sectors. So if you don't know about this thing called the Safe Cosmetics campaign, very interesting to know about that. It was a campaign that actually it was launched kind of out of healthcare without harm in a funny way, because we were finding that kids in the NICU had this chemical in their body called DEHP. It was a certain class of chemicals. And it was because in the PVC. And the PVC IV bag leaches this chemical into the patient's body. But then the CDC, the Center for Disease Control, was doing all these studies of average Americans saying, look, this chemical, DEHP, is in everybody. So how could everybody's not going to the hospital, everybody's not getting infused, where is this DEHP coming from? And so we started to test products, and we got a bit of a tip from the Center for Disease Control, and they said, you should test some cosmetics. And so we did, with some others, including the American Nurses Association. And we started to find this chemical in cosmetics. And so it kind of led to this whole other campaign that started that was focused on the cosmetics industry. So there's a website. If you go to that campaign site, there's a website run by the Environmental Working Group that has a database of 5,000 cosmetics products that you can click on and find out the toxicity of what's in those products. It's a fantastic thing. And it's forced the cosmetics industry to start detoxing their supply chain and moving toward greener chemicals. Same thing is happening in the building industry. There's an organization called the Healthy Building Network that's evaluated building materials for their toxicity and their climate impacts. And they've got an amazing tool called Pharos, P-H-A-R-O-S, that will, if you say, okay, I want to buy this kind of synthetic lumber, you click on it and it'll tell you the life cycle and the toxicity impacts of that. So that some things are happening in the building industry, in the cosmetics industry, it's happening in the electronics industry, it's happening in the car industry, it's happening in many, many, many sectors. And what's interesting about it is that the sectors that are sort of detoxing their supply chain, it's good for business. This whole argument that somehow the environmental improvement is going to be bad for business is completely a faulty argument. If you're Hewlett-Packard, right, and you can clean your computer chips, your silicon chips, with distilled water and citric acid, lemon juice, as opposed to trichloroethylene, which contaminates the groundwater, why wouldn't you do it? It saves you a ton of money and you have no liabilities. If you're the chemical industry, of course, you want to continue to sell trichloroethylene. So what we found is that the downstream industries are the ones that are making this transition because they realize that it's better for business to not poison their customers with their products. It's a no-brainer. And so the kind of innovations that are happening at a Carnegie Mellon, the University of Massachusetts at Lowell, and many other universities are being taken up by these downstream industries, including the pharmaceutical industry. Does that help?
Yes, thank you.
Others? I know we should. Do we have breaks and coffee and
Yes, we have a
snacks?
break now.
Sustainable
Yes.
sustainable snacks.
Sustainable snacks.
Sustainable snacks, gluten-free,
They
home
are
free
vegan.
range.
Vegan. They're
Vegan.
vegan.
We actually, just one more thing. When we were at University of Pittsburgh, we did a conference we did one of our Clean Med conferences a couple years ago in Pittsburgh, and UPMC was a sponsor and others, and the hotel had no idea what any of this stuff was. So when people went out to get their coffee, it had a big sign that said free range coffee. So hopefully you'll see some of that out there today.
Thank you. We're going to take about a 15-minute break, and then we'll
Thanks.
come back to hear from our panel.
Yeah.
Thank you.
Yeah, I think so. CMU Johns. Yeah, I've got it. I've got it up here. I copied it onto the desktop up here, so we should be all set. Have it right here. There you go. Yeah, I know. Yeah, definitely. Don't lose that. Yeah. Oh, yeah, that's great. Yeah, I didn't know whose that was. So, yeah, and this is yeah, we should be all set. So, it says CMU Johnson, and then today's date. Yep. Yeah, I figured that was the one. Yeah, you can take a look if you want to. It's up here. All right. It says tunnels, huh? Yeah. All right. So where do we want to go closer in?
Maybe just right here.
Okay. Yeah, I think that's right.
Look from down there because you can't really tell.
I know.
Okay. Yeah, I think it's just the first like row. It's a odd space.
It's gorgeous.
Oh, that's-
Everybody is talking about how beautiful it is.
Yeah, yeah. I know they could do some upgrades, but then, you know, you gotta. I'm sure they want to keep
They
it.
want to preserve
Yeah.
the way it looks, 'cause it really does look
I mean, well, but I don't know if they really do, like, I guess, drama things in here or anything. I mean, because they have the curtains. I mean, if they just got rid of their
They must do plays or something. Look, they have little X marks.
I think like the music department does some stuff in here once in a while, but I don't know that they actually do. Yeah, I mean, it may just be like left over from years gone by. It is.
I know, Terry.
You don't see
offered
they don't build them like
space.
this.
No, and he said it's tremendous, and I thought, okay. And then I went and saw it. And even yesterday, somebody suggested we move to a smaller room, and I said, oh no, we can't move out of this room. It's so beautiful. You know, even though we're not filling it, it's still.
It doesn't get used that often, really, as far
That's
as I
what
can
I
tell.
heard.
So I think just because it's old, you know, and
Which is too bad, because it is beautiful. I would use it again.
well, I think just because it's mostly like biology and that kind of stuff over here.
It
now.
is. I saw
So
that
it's
there's
like not really-
labs.
Like maybe I think maybe at one time, you know, they had like more like theatrical sorts of things.
Oh,
but,
maybe.
you know,
Maybe this
like,
is where the
yeah.
schools of music. Yeah,
just
we're going to
building
put
some-
everybody over there. I'm going to ask if you are sitting on the right side of the room, if you might want to consider moving over to the other side, because this table is going to obscure some of the slides. But we have our panel coming up to sit at the table. So it's up to you, but you'll have a better view if you move over.
You got some smiles.
I know. Oh, thanks for coming back. We're almost ready. Because we have the table here, I was telling people if you want to move to this side of the room, you'll probably have a better view. We had to move the table up for our presenters, who I'd like to join me now. Thanks, guys. So where is... I think I was going to let Phil go.
Okay, his is right. If you just click on that. Or,
Oh,
I'm
see.
sorry, did I have the right one?
And it's also on this one. I guess we don't need everybody just sitting up here. You're right. You're right.
Oh, that's right. So.
Okay, thank you for coming back quickly. And I just want to say to Terry and Gary, I'd really like to thank them very much. I knew they would be wonderful presenters, but I think they did just an exceptional job this morning. And now we are going to continue with our panel, which is going to give you a little bit of information about some of the things that are already happening in healthcare towards the sustainability model, and some of the things that are happening in Pittsburgh, and also what the Pennsylvania Nurses Association has been involved in. So our first presenter on our panel is Philip Johnson, and he's a senior program officer at Heinz Endowments in their environmental program. So he oversees one of their latest projects, which is called the Breathe Project. And he's here today to tell us all a little bit about that. Please welcome Phil.
So I'll open this up.
Where is yours? I think this one's yours.
Right in front of me.
Oh, not there?
It's already open. Thanks.
Excellent.
Thank you so much for the invitation to come speak and the opportunity to talk about the Breathe Project. I am one of several people who work on the Breathe Project. I can't say that I oversee it, but I definitely am a part of it and I contribute to it. And okay. Did anyone hear what I just said? Okay, I'll start over. So my name is Philip Johnson, and thanks to Magee for inviting me to come talk today about the Breathe Project. I'm one of many people who work on the Breathe Project over at the Heinz Endowment, and I can't say that I oversee it, but I'm a contributor to it, and I've been responsible for our environmental health portfolio within the environment program. And air quality is an area that we've been working on quite a bit over the past few years, and actually we've been working on air quality issues in this region for several years, long before I moved to Pittsburgh and joined the endowments a few years ago. So today I'm going to answer the question as to what is the Breathe Project. And part of the answer to that question has to do with air quality and health and air quality in Pittsburgh, so I'm going to cover those topics. And then I'm going to close by digging more deeply into the Breathe Project and what we're doing. So with that, I will start. So late last year, some of you may have noticed some advertising that we initiated at the Heinz Endowment. We took a forward and an active role on this issue. We made a decision that we needed to take a stronger and more higher profile on the air quality challenges in this region. Rather than just making grants and doing grant making, we thought maybe we could spur an initiative and work with our grantees and with other groups to really try and turn up the volume on our air quality issues. So we started doing some advertising. It was all around the concept of connecting the dots, and that our skies, while largely free of large diameter aerosol particulate, were loaded with small diameter particulate, which is really presents quite a health risk. You may have seen or heard about the Breathe Project when we launched it last autumn. This is the logo. You may be aware of the website. It's quite an interactive website with lots of material and information on it, prescriptive information, educational information, coalition building information. And really, essentially, the definition is we're a coalition of businesses, government, nonprofits, residents, and many others in this southwestern Pennsylvania region. We're trying to clean up the air in the region, and we believe this relates not just to the health of our families and our environment, but also to the future of our economy. In short, this is about well-being and quality of life. Health and economy are both factors in well-being and quality of life. So one of the aspects of our efforts to educate folks is to really talk about this in a multidimensional way. On the website, we can see how we try to show and identify how these things are all interrelated: economics and health and pollution sources in the region, what pollution does, our status, our rank compared to other cities in the country with pollution, and most importantly, what solutions are there? What can we offer up as solutions, and how can we generate solutions? So why did we get into this? Why did we start to take such a higher profile than we have in the past? We did a lot of focus groups and a lot of surveying that was statistically generated by social scientists about 2 years ago. And we found what I would call quite a disconnect, because while this region over the past 10 years has been number 1, top 5, and top 10 most polluted cities in the country for fine particulate matter, the majority of Pittsburghers who were surveyed felt that the quality of life was excellent and very good, and that air quality and environmental threats were not part of that calculus. And only 14% felt that a lot of work needed to be done on air quality, in spite of the fact that we have such terrible performance in our ranking relative to other countries in the city, many of which are much larger than Pittsburgh. So that is a disconnect. There's a break or a connection, a lack of connectivity or consistency. It's incongruous that folks would live in a city that has some of the most insidious air pollution in the country and yet feel that very little work needed to be done on that problem and that it didn't really materially affect quality of life perceptions. So, speaking of disconnects, the late David Bates in 1952 was a pulmonologist in London, and he's also the father of air pollution epidemiology. So here's a person who joined an MD and an MPH, two professions in a very synergistic way, and he reflected back on the smog event in London, where for a week a pall of heavy pollution was trapped in the city from an inversion. And he said, we were in the wards and the bodies were coming in, but we just thought it was another influenza event. It was the farmers whose cows were dying in the fields and the people at the morgue who didn't have enough caskets who told us that something different had happened that week. And retrospective epidemiology determined that there were actually excess of thousands and thousands of deaths, excess deaths, and that the lag effect from these morbidity and mortality events was actually over 2 months. So people who experienced that week of pollution in London were dying 2 months later because of it. And so while back then there was a mixture of small diameter and large diameter particulate, now we've largely scrubbed out or removed that large particulate so we don't see it as much as we saw pollution in past decades, and Pittsburghers can very much relate to that in this city. I think of small particulates as being especially insidious because they go deep into the lung, and I think of this tree in Central Park, New Jersey, as a nice picture of a lung. It's got the trachea, it's got the bronchioles, it's got the alveoli in the leaves. It's got a lot of surface area to collect what it needs, similar to our lung. So our lung has 50 to 100 meter square surface area. That's the largest surface absorption organ in our body, much larger than skin of an adult. So this blood gas interface becomes a portal not only for these aerosols, but for toxic compounds that absorb onto the aerosols. They essentially have a means or a vehicle to hitchhike deep into our systemic biology, and actually these aerosols go through the blood-brain barrier via the olfactory nerve. So they not only go in via our lung, but also up through the brain. And so that's why we see a lot of these health effects for fine particulate matter, increase in respiratory symptoms and chronic bronchitis. It's also a cardiac issue, leading to premature cardiac deaths as well as pulmonary respiratory deaths, and also an increase in lung cancer. So this affects folks who have allergies, folks who have asthma, folks who have COPD, anyone who has a cardiac disease or condition, including diabetics. And let's not forget about ozone, another serious contaminant that we have problems with in Pittsburgh. For a while, ozone was believed to be only a respiratory issue, but it's also a cardiac issue. So the inflammation, the biological mechanisms that both of these contaminants, what can explain the biological mechanisms is they both contribute to systemic inflammation, and then so you get both cardiac and respiratory pathways. The fine particulate matters were only really figured out as a massive public health problem about 15 to 20 years ago because of some large cohort epi-studies that were done across many cities in the United States. First the Harvard 6 city, and then later the American Cancer Society cohort, which was 500,000 people, and it's actually grown in dozens and dozens of cities. So these studies have been replicated across the industrialized Earth. They see these same kind of signals happening wherever we have humans and combustion and other kinds of airborne sources. So they found relative risks increases for cardiopulmonary lung cancer and all-cause mortality. 14, 19, 21%, for example, with the 6-city study. One of the dirtiest cities they looked at was Steubenville, not far from here, and one of the cleanest cities they looked at was in Kansas. So they took the death gradients and tried to rule out all the confounders, and this is what they attributed to excess air pollution, in the face of increased air pollution, excess death and disease. I think most people here know that our high-risk groups are a significant percent of our population. We did a study in the Northeast United States, which included Pennsylvania, and when we counted up the percentage of folks with lung and respiratory disease and counted up children and counted up the elderly and counted up people who were in high-exposure environments, it was almost 30 to 50% of our entire Northeast demographic. So this is a huge pool of susceptibles that are having problems from exposure to these contaminants. If you look into some of the studies, some of the best studies are the long-term studies coming out of California looking at children's cohorts over 8 to 15 years. And here's one of dozens and dozens of them where on this plot you see that these diamonds are communities, and out on the x-axis, the communities with higher particulate matter, upwards of 30 micrograms per meter cubed, have much higher rates, have much higher hazard ratios connecting lung function with onset of asthma, as compared to the communities on the left side of the x-axis that have lower amounts of pollution and therefore a lower hazard ratio. And this researcher concluded that exposure to high levels of PM2.5 attenuates the protective effect of better lung function against new onset asthma. These studies are everywhere. They're all over the place. This is just one of many. An interesting fact I learned not long ago is that Pittsburgh is considered by the Asthma and Allergy Foundation of America to be the 4th worst asthma capital in the country. And that's not just about air pollution, it's about other asthma triggers and other ways of how asthma is treated and how medications are used. But air pollution is a big factor, and I don't think it's a coincidence. So to sum up, poor air quality does hurt our health. There are numerous studies, they're consistent. They're telling the same story. It's a huge exposure magnitude, it's a huge magnitude of risk, and the impacts are actually quite significant. California actually quantified what PM2.5 exposure did across the state and came up with nearly 9,000 deaths, which were more than motor vehicle crashes and homicides combined for the state in 2007. 500,000 humans are estimated to die a year prematurely from exposure to particulate matter. Joel Schwartz at Harvard believes that these aerosols are the greatest environmental health killer of the millennium. But it's also an economic issue. We have lots of ways of connecting air quality and health to economy, whether companies want to come and relocate to a dirty city, whether employees who are now more and more mobile really want to work in a place when they have other options and other places to work. If we're in non-attainment, which we are for particles and ozone, what does that mean for manufacturers who want to come here and yet can't have any emissions whatsoever because they can't add to our overburden? They might not come here. They might not come here with their job base. We could be at risk of losing federal transportation dollars for our interstate system. And also, air pollution reduces employee productivity as well as child productivity. So in California, not only did they see almost 9,000 premature deaths, but 8,000 hospitalizations, 210,000 respiratory illnesses, 1.4 million lost workdays, and 4.7 million school absences in 1 year, attributable to exposures to particulate matter in the state. When Congress and different regulatory bodies that assess the effectiveness of rules and regulations look at the Clean Air Act, they find at a minimum that the benefits are 4 to 1, where the amount of money you spend on cleaning up air, you get 4 times the amount of payback in less healthcare costs. For example, 4 to 1 is actually one of the most conservative ratios I've seen. Some of them go up as high as 20 to 1 and even higher. California has some really fantastic ratios that they put together on this. So the monetary benefits of reducing exposure, of preventing exposures, which I think has been a theme today, far outweigh any costs to society. So let's get into the Pittsburgh air pollution problem, and then I'll wrap up by talking more about the Breathe project. So in Acadia National Park, when the air is super clean, it's coming from the north. These are back trajectories done for 2 years in the end of the 1990s. You can see those little red lines basically go backwards up into boreal Canada. And so the clean air is moving in because as we know, air is synoptic as well as local. It's a function of local and regional scale weather systems. So lo and behold, the 20% worst visibility days, and visibility is a good indicator of particulate loading in the atmosphere, come from the United States, and those lines all kind of roll right over us. So here we are in 2010. When I moved here, I used to take these pictures on our 30th floor office looking down the Ohio River Valley because I was just blown away by how polluted our horizons were and our local air quality. And there's the baseball park and the football stadium. And so keep your eye on the red line. So this is fine particulate matter, which we all say is invisible. Well, actually, it's not invisible. It smogs up the sky pretty well. Not like the black skies of 50 years ago, but it's still a visibility issue. That's what Pittsburgh looks like on a much cleaner day. So and these days here are so common, I can't even tell you how many of these pictures I have with different dates. At one board meeting we had, I showed our board like 30 of these pictures. Here's March 2010, here's April, here's June, here's December, here's... I think they got the point that, you know, this is a problem. And so let's look at some Pittsburgh data. Of the 11 PM2.5 monitors we have in the region, 6 of ours rank in the worst 10% of the country, top decile. And all of them rank in the worst quarter for daily 24-hour average PM2.5 concentrations. So we are so polluted here compared to the rest of the country. It's really quite stunning. And not only are we polluted, now that's not to say our air has been getting cleaner. It actually has been getting cleaner. So that's after a decade or two of air quality improvements. But compared to the rest of the United States, we've been getting cleaner much more slowly. So we're in the back of the pack and we're kind of stumbling. So all these other cities are getting cleaner more quickly than we are. And so relative to these cities, our air problem is getting worse. Our power plants in western Pennsylvania alone, we have about 18 coal-fired facilities in just western Pennsylvania, so it's not necessarily all about Ohio and Kentucky and West Virginia and Illinois and Indiana's fleets. It's our fleets, because our fleets have been the slowest to reduce their SO2 and NOx than any fleets east of the Mississippi River. So our power plants in our backyard, which surround this city, have been cleaning up much more slowly than the rest of the eastern United States power plant fleets. When you look at morbidity and mortality modeling estimates used by EPA and applied by some advocacy groups, they find that 4 Pennsylvania MSAs rank in the top 10 for mortality attributable to power plant air emissions. So 40% of the MSAs in the country, we represent them in terms of mortality impact. When you look at source apportionment, actually 1/2 to 2/3 of PM2.5 in Allegheny County comes from Pennsylvania sources. And as I said a minute ago, our air quality for criteria pollutants is a non-attainment, meaning we don't meet the federal health-based protective standards. Let's talk about toxics and cancer. Air toxic emissions for Allegheny County are the top 12 worst in the country compared to 3,200 other counties. If you actually do that math, it's about 0.37%. So actually we're in the top 1/2 percentile worst for cancer risk from industrial air toxic emissions in this county. Our cancer risk from all air toxic emissions is number 15 in the country. 20 of our air toxics are above the national 50th percentile, 13 are greater than the 75th percentile. And there are about 4 or 5, including hydrogen sulfide, which are greater than the 95th percentile. That means that 95% of the country has lower emissions for these toxic compounds than Pittsburgh. Our lifetime cancer risk from diesel soot is 408 times greater than EPA's acceptable cancer level. That's a stunning statistic, by the way, putting us in the top 3% of the most unhealthy counties in the United States. Our black carbon concentrations, which are a heavily influenced component of diesel particulate matter, measured in downtown Pittsburgh, were higher than sites in downtown Manhattan and along the Garden State Parkway in New Jersey. And I used to commute on the Garden State Parkway, and I can tell you that's a very embarrassing statistic. So we have quite a few susceptible populations, as I talked about earlier. 20% less than 18, 17% older than 65, for example. We actually have studies that have quantified what hundreds and hundreds of studies around the United States have also quantified. We have studies unique to Pittsburgh. For example, connecting low birth weight outcomes to particulate matter exposures in Pittsburgh. And so we have sources. We have sources that blow in from the Midwest. I don't want to trivialize or discount those. We have a lot of our air pollution coming in from Midwest upwind sources. Here's a picture of the Ohio River Valley from just above the Pittsburgh airport. That brown line is pollution, regional transported pollution. We have local sources, lots of them. We also have local industrial sources. That's diesel coming out of a bus. And we have increasing amount of sources coming from natural gas production. How many minutes do I have? A couple? Or am I over?
No, go.
Okay. So this is a refining processing facility over in Washington County. This is an old aerial from Google. It's actually filled in nicely. This is about a 90-acre site processing not just methane, but ethane, I think butane and propane, liquids as well as other product coming out of the ground. This is quite quite a new phenomenon over the past 3 or 4 years, and modeling that's being done at Carnegie Mellon is actually suggesting that this could contribute substantially to our pre-existing ozone problem. And just to wrap up the air quality dimensions of Pittsburgh, here from the Environmental Protection Agency Air Now air quality archived maps, you can see that in July, these are all the days in Pittsburgh. What you're looking at is Pittsburgh, the Pittsburgh region going over to the border. Pittsburgh's basically in the center of each of those little maps. Each map is a day, starting on Sunday, July 1st, going to the 10th. We've been in code yellow and orange for parts of that quadrant almost every single day. Here's what June looked like. So we really do have quite a pollution problem here, and there's just no denying it. So what we're trying to do is build public awareness. We're trying to shape and strengthen public perceptions and attitudes and awareness of this problem and why it matters. We're trying to reach out to a broad constituency base in the community. Civic leaders, civic folks, businesses, nonprofits, government, individual. We're trying to enhance our current grant making, which has been substantial and will remain substantial, synergizing collective action, as well as individual strategic work by grantees. And we're trying, most importantly, to get outcomes, to get tangible source reductions, as well as awareness of the issue, as well as hopefully compliance with federal standards. We're trying to help our Allegheny County Health Department and the state DEP do its job. We're trying to promote some of the things that they're really aggressively trying to do to clean up the air, and we're trying to bridge business communities and NGO communities and educational communities and civic communities and individuals in this common shared goal. To date, we have about 85 coalition partners and over 1,000 individual members of the Breathe initiative. And we are already helping add to ongoing solutions. We have CEOs of major corporations now coming together with public health experts and environmental advocates and elected officials. Just yesterday, we had our first leadership committee meeting that met at the endowment's offices from all these different sectors and constituencies to come together to talk about what research do we need to do, what solutions are there already that we need to promote, and what should our objectives be on how to reduce air quality in this region and this city as quickly as possible. And there's already been successes. There's been a lot of reductions in diesel coming out of the Pittsburgh school buses, as well as construction trucks in the city. We had a medical conference that we co-sponsored a medical conference with West Allegheny on asthma and the health effects of air pollution and other triggers relating to asthma. I mentioned how we have a growing group of organizations and individuals joining this coalition. And we're just trying to build the networks of information to citizens, to build stakeholders, and to really get this out of the realm of just science and out of the realm of just regulations into the realm of civic understanding and collective civic action. And here are some examples of things that some coalition partners are doing. PNC Bank is doing green construction. They've been a national leader in that for a long time. Tree plantings by the Pittsburgh Parks Conservancy. Trees actually help reduce and absorb pollution, reduce pollution in the air by absorbing it. Carnegie Mellon, which has been mentioned today, has been purchasing clean energy for quite some time. And the Pittsburgh Pirates have been implementing a host of energy conservation measures. This stuff isn't attributable to the Breathe Project. These are folks who've just joined the coalition because they already get it and they're already doing things and they're going to do more. So the website is breatheproject.org, and I'll stop there. I apologize if I went over a couple minutes. And this is what the skies over our Pittsburgh Stadium should look like. Thanks.
There will be time for questions for Phil and the other panelists once we're done. But I want to thank Phil because that was really enlightening and also alarming. So I hope it inspires people to join the Breathe Project and let your voices be heard and help to clean up our air here in Pittsburgh. But our next presenter is Dr. Noe Copley-Woods. She's an associate professor of obstetrics and gynecology at the University of Pittsburgh Medical Center. Noe's clinical practice is at Magee-Womens Hospital, and she also does research there. And she researches physician practices and how they impact waste and how they impact energy use. And she has a recent publication that I'm going to reference, and I want to make sure I get it right. It's called Life Cycle Assessment Perspectives on Delivering an Infant in the United States. And what life cycle assessment does is it helps to identify environmental impacts of medical procedures. So Noe's going to share some of her work with us today.
Great. Thank you, Judy. Is this on? Can you hear me? Thanks, Judy. Let me just pull this up real quick here. Now, I wanted to be really dynamic like Dr. Collins and walk around the stage. But you brought your own pointer, right? That's how you did that. Wow. So thank you for having me. It was really interesting to hear all the other speakers. And as a segue to what I'm going to talk about, you know, when you get your asthma attack and you go into the hospital, the last thing you ask your physician is, did you open any unnecessary packaging, you know, when you treated my son? And those are the questions that I'm asking. They're very hard questions to ask. And so the title of this talk is Warming Up the Hospital, the Science and Art of Green Medicine, because it involves both science and art. As you know, Magee, right down the street, is a center for women's health. We deliver about 10,000 babies, or 12,000 babies a year is about what we deliver. So that's pretty active labor and delivery, and we do about 15,000 surgeries. So it's a busy, busy hospital. And I became interested in this because as a medical resident, as an OBGYN resident, you know, I would do a 10-minute procedure and find that I'd produced 4 or 5 huge bags of plastic trash. And I became somewhat dismayed by the amount of waste that I was producing. Am I talking too loud? Is it too echoey? Oh, you're turning it down. Oh, thank you. Okay. So just to give you a sense of how we came to this point in medicine and what the environmental issues are in a hospital. And the first thing I'll say is I'm a gynecologist, and I've tried to scan this talk for any gross slides and take out anything which would be offensive. So let me know if there's anything for a general audience that was inappropriate, please. But this is a picture of a woman undergoing a mastectomy for breast cancer in the 18th century. And at that time, what made a good surgeon was the eye of an eagle, the hands of a woman, and the heart of a lion. Fast, swift, get it done. And, obviously, very nice suits. You can see that during their surgery, they were very well dressed. And this woman actually survived this surgery to write about her account of it. Of course, she had virtually no anesthesia, and you can see, obviously, they're not even wearing gloves. So we've come a long way. We discovered the germ theory of disease between then and this picture in the early 1900s where you see Harvey. He was one of the first neurosurgeons. Here he is doing neurosurgery in what was called, why we call operating rooms theaters. You can see why. And you can see suddenly they've put something over their mouth. So they've discovered, okay, we shouldn't be transmitting our bacteria to our patients. That's bad. And you see the beginning of things being disposed of in the healthcare field. And let's jump forward to the 1960s, before HIV. This is Dr. DeBakey, who, for the nurses in the room, designed the DeBakey pickups, the best surgical instrument ever. And here he is doing the first televised open heart surgery. You'll note they're still well dressed. You see the pump on the circulating nurse there. That no longer happens, sadly, in the OR. You can see her little fancy shoes. And this is an operating room before HIV happened. Everything is cloth. Okay, everything you see here is going to be reused. All the cloth is going to be washed and reused. All the instruments that Dr. DeBakey is going to use are stainless steel. They're going to be autoclaved and reused. Even the anesthesia here is going through glass bottles, which could potentially be reused. It's your agent. You got the part. And here's what happened. So the 1980s happened. HIV happened, and suddenly we started throwing everything away. We started moving towards disposables, and unfortunately, we can't really quantify this change. It happened gradually, it happened insidiously, but we can see something dramatic happened in healthcare. This case, by the way, the surgeon, okay, this is a robotic surgery. The surgeon isn't even in the picture. There's a fuzzy blue thing off to the side. That's actually where the surgeon's sitting. They're remotely controlling the instruments that they're using. Even the instruments they're using are going to be thrown away. So there's robotic arms that are used 25 times and then ditched. All of the ports going into the patient are going to be ditched. Now, would you rather have this robotic surgery than the mastectomy without anesthesia? Of course. The patient who leaves this room is going to have a total incision maybe of this big It's going to be made up of 4 or 5 several millimeter incisions. Well, that's better. But what are we doing with our technology here? We've been designing our medical technology for function without any consideration for sustainability or long-term design. And now is the time. We've optimized in many ways the functionality of these instruments, and now is the time where the healthcare sector has to ask the question, can we really afford to throw away this entire blue table with these $700 instruments? Can we afford to throw that in the trash anymore? And just because there's blood on it, does that mean we have to throw it away? Are there more sustainable ways of disinfecting our instruments? Painters, carpenters, mechanics, they wouldn't throw out their instruments every time they do a case, but a surgeon does. And that's the way we've designed our surgery. Here's a C-section. The only thing in this room that doesn't get thrown away, you guessed it. Even those blankets often get thrown away. So one of the biggest challenges in healthcare sustainability is the enemy of infection. So we have developed culturally a paranoia, a germophobia that is not, I would argue, is not based in scientific principles. It is a fear factor that has escalated to the point where we're disinfecting surfaces in the hospital with extremely intense chemicals. And at what point is the toxicity of those chemicals worse than the potential infection risk from that bacteria? Where do we draw that line? At what point is the environmental impact of throwing away that plastic worse than the potential reduction in infection? And the truth is that here you can see, almost everything here is going to be thrown away except for the stainless steel. We don't know that reduces infection. There's actually very little data about what reduces infection. And much of the changes that have happened in medicine have been based on our disgust at germs, rather than based on studies that illustrate something as environmentally or as infectious disease is preferable for reducing infectious diseases. Here, this is the amount of trash I produced in 30 minutes. Here's the amount of trash I produced in 9 minutes. I could do this procedure probably 10 or 12 times a day. In a half day, I could produce this 10 times over. When I go to the patient waiting area and I say, congratulations, your family member is safe there, everything went fine, they're okay, I get asked a lot of questions, most of which are perfectly great questions. Sometimes they're a little bit off, can we have the ovary? Did she say anything about me while she was asleep? But I've never been asked, did you open something that you didn't use, doctor? Did you throw out extra materials? Never. That is not our agenda when we go get our health care. But it has to be our agenda in the hospital, and the challenge of green healthcare is reassuring ourselves and those that we're trying to convince that this is not reducing quality, and in fact that it's doing the opposite, that it's improving quality. Perhaps it would be much more efficient for me to do a surgery where I'm not throwing out the entire room after I do some simple procedure. And so that is the crux. That is the tension always, is maintaining our quality of care, but also having an environmental endpoint as part of the agenda, which I would argue now is really, through practices like Healthcare Without Harm and Practice Green Health, only starting to enter into the conversation. I told you we deliver 12,000 babies a year. Here's one baby I just gathered together, normal delivery. Here's how much waste we make. One baby, 12,000. This is happening every few minutes at Magee-Womens Hospital. And so, and by the way, Judy, where are you? You're going to have to cut me off because I have so many slides, so just drop the axe when the time is up. Because I just went crazy. She only gave me 15 minutes so she wouldn't overwhelm me, but I just have a lot of slides. So I started to get dismayed about specifically the amount of trash. And so I started this whole journey when I got to Magee with just following our waste and figuring out, okay, where do these waste streams go? And what is a logical way to try to reduce the impact from these various waste streams? And here's an example of a hysterectomy. And I don't think the engineer in this picture is here, but a few engineers who have done things like this are here. So a hysterectomy, for example, produces about 30 pounds of trash. Depends on how you're doing the hysterectomy, but here's an engineer, and I'll show you this study a little later, going through the trash, and we're kind of quantifying what are the materials here, how much of them did we use. And incidentally, at Magee-Womens Hospital, once you become an inpatient, you produce about 31 pounds of trash per day while you're in that hospital. Average American is 4.5 pounds just in your regular life. So when you get sick, you start consuming things. So I got interested in our trash, started taking some field trips to follow our waste. We have something in medicine, many of you who are in healthcare know about this, regulated medical waste, which is a little bit nebulous in terms of what is regulated waste and what isn't. We produce quite a bit of it. This slide was made back when I was using T-Rex weight equivalents. We produce from Magee-Womens Hospital 294 equivalents of a Tyrannosaurus Rex go into the landfill every year. I did that when my first son was 4, when T-Rexes were like actually a big part of my life. That made more sense to me than a ton, but you can picture that's quite a bit. It's 6,000 T-Rexes per day from healthcare into landfill, so it's a big problem. So we followed this waste, and it turns out that when we generate infectious disease waste, we bag it up in special packaging, we put it in a special truck, we drive it to this autoclave in McKeesport where nobody touches the waste, you push buttons, it goes into this autoclave, it gets heated up to 250 degrees for 45 minutes, it comes out of the machine, it goes through all this assembly, and eventually it gets trucked to a landfill. And it's very expensive and it's very energy intense. This is the landfill where our waste eventually ends up. And this is where our incinerated waste goes. It goes to North Carolina to this incinerator. And you can see next to it a group called POO, Prisoners of Our Homes, who are the protesters for our particular incinerator. And pathological, I won't bore you with all the intricacies of medical waste streams, but chemo and pathological waste by law has to be incinerated. And ours, not only is it incinerated, it's trucked and for some inexplicable reason refrigerated on the way. Here's our chemo path. So when we treat cancer patients, we are using PVC plastic in the UPMC system. We're definitely trying to get away from PVC. We've gotten away from it in our NICU. Our NICU is totally free of it. But our chemo is still being given in PVC plastic, being put in this refrigerated truck, which when I went to go tour, it was open and refrigerated, and then trucked to North Carolina. And you can see this. This is where I hope this isn't too gross, but this is a refrigerator full of placentas. And we deliver 7.5 tons of placentas a year from Magee, get trucked down to North Carolina. And this is our recycling plant, which we toured. And as a result of all these tours and looking at our waste streams, we started a bunch of fantastic initiatives. So we got kind of excited about the red bag waste reduction. And within a year, we halved the amount of red bag waste we were making. And we did that by educating people about what is red bag waste and what is not red bag waste. Very simple. Saved money, got buy-in from administration, and saves money in perpetuity as long as you're segregating waste properly. And so we brought our adjusted patient days amount of red bag waste basically in half per patient in the hospital. So that was a big win. And that, to me, is the art of Green Hospital, which is that you start with an initiative that saves money, that makes people happy, and gets people's attention. And that's what we started with. And this is probably too small for you to appreciate. I'll just summarize it with words. But we basically tried to resegregate our waste as a way of starting our environmental efforts. And what we did is essentially increased our recycling, decreased our regulated medical waste over a period of 3 years. And these graphs illustrate that. Incidentally, our path in chemo, which is in the second graph, the first column, goes up each year. We're treating more and more cancer. That's probably because we're doing more chemotherapy every year. And this pie, which is also a little bit small for you guys to see, represents sort of the incremental changes that we've made in our waste streams over time. So you can see the green is getting bigger. That's the recycling. You can see the red is getting smaller. That's the really energy-intensive regulated medical waste. So that was a great win-win for how to resegregate waste. And the next big challenge is how to reduce that entire pie. How do we just produce less? And that really goes into purchasing and what kind of things what we're buying upstream with all the excess packaging and so forth. This is a fantasy slide. My fantasy is that I will use wetlands someday to detoxify medical waste. But this points to some of the strategies that we're using to change things at Magee. Here's a hospital, Boulder Community Hospital, actually uses cloth diapers on their newborns. They compost all their food waste, on and on and on. And I always remind them, that's because you're in Boulder. All of your patients are hippies. We can't do that in Pittsburgh. But we can try. Here's we wanted to look at births because we have a lot of those. This is the paper Judy was referring to, and these are my collaborators who are both University of Pittsburgh civil engineers. Amy Landis just moved to Arizona, but we're still collaborating on what's called life cycle analysis, which many of you are probably familiar with, which is basically a way of quantifying environmental impacts. And we did a life cycle analysis. Our functional unit, which is the term, was a baby, and we wanted to see what is the environmental impact of having a baby at Magee. And we compared a C-section and a vaginal delivery. And we basically looked at all the kits we use, the electricity, all sorts of things about the delivery itself. as a surrogate for understanding what are the components of when I deliver a baby, what's the big money players in terms of targeting environmental efforts. And here is just the global warming impact category. So red is a C-section, blue is a vaginal delivery. I'm sorry the blue is on blue, but I couldn't fix it in time. But you can see that the red is obviously much more significant, which you would expect. A C-section is a surgery. A vaginal delivery is, although we try to medicalize it, is typically not a surgery. And you can see that the C-section is about twice, roughly, of the vaginal delivery in terms of its environmental impact in the global warming category. But then we broke it down. Okay, what are the things? And the big winner over to the left is the heating and ventilation and air conditioning. And I put this slide because I really think this is an area that we need to sink our teeth into deeply. Because what makes the HVAC so intense in a hospital is we turn over the air 20 times an hour from fresh air. And that's based on federal regulation, which was set by the HVAC companies. There's no study that shows if you have 19 turnovers per hour, you're going to have X number of infections, and if you have 20 air turnovers per hour, you're going to have some significantly reduced rate. This is a number pulled out of, I'm not sure where. And what would really benefit us is making that number based on science. What is the optimal number of air turnovers per hour which reduce your infection risk without causing this kind of energy intensivity in a hospital? Our lobby is turning over, 20 times an hour. Our hallways, our lights are on 24/7. We're just an energy suck. But you can see, especially in the OR, when you do a C-section, that's what's impactive. And now the key here is we actually limited this study to just the duration of the delivery. If you actually factored in the air turnovers per hour in a 24-hour system, this would go up, because most of the time we're actually not in the OR. So this is actually artificially low when you actually look at what it takes to run an OR. Those air turnovers could be turned off when somebody's not in the room. There could be a switch, there could be a light sensor that turns that circulation down as soon as you exit the room. And in fact, there are places that are trying to do that. And we're looking at seeing if that's possible with the way our HVAC system works. But this data helps us realize, wow, that's someplace we should really target. We're really going to make a big difference if we look at that. And the other little thing, which you probably can't see because of this table, is that the disposables outweighed the reusables. So the things that we're throwing away, all that plastic stuff that I'm throwing away, outweighs my reusable stainless steel instruments for a C-section. This is just looking at the disposable versus reusable here. So, and this is a big debate. When I talk to physician audiences, we have grown dependent on these disposable materials. We've changed our practices over time, and you'll hear older docs say, "Oh, we used to just take out a Q-tip and do it all with a Q-tip," or whatever. They have this. They remember it being very different, and now we open up this whole extravaganza. And some people say, well, how do you know that the stainless steel and the washing and the water intensivity isn't worse? Well, we showed that it's not the case. So at least in terms of the C-section, the disposables, which are the black columns, are really taking up the majority for this surgery, for this C-section. And the reusable instruments, even when you count in the sterilization and the heating and so forth, is still less of the impact. We looked individually at the specific components of our packs to see what their environmental impact was. The idea being that if we can take one syringe out of the birth kits, that's 12,000 per year. And so we're using this information to help us direct our efforts towards how to recustomize these packs. Okay, the next few slides have a few medical things on them. If you want to close your eyes, feel free. There's nothing too gross. I think there's really only one picture of a uterus, but I just want to warn you. So I'll finish up real quick. So one thing we're looking at, so the future of surgery specifically is minimally invasive. So our instruments are getting bigger, our incisions are getting smaller. And this is a bigger incision, so this is what you call a laparotomy. This is the traditional way to do surgery. That's a uterus down there with fibroids. And we're moving away from this, and surgery trends are showing, and this is much better for patients. It's much easier to heal. Laparoscopy is where you make a little hole, and then robotic surgery is where you use a robot to do it remotely. And then natural orifice surgery is when you're doing it through a hole that already exists, like the vagina for a vaginal hysterectomy. And we're looking at those 4 ways of removing a uterus and saying, what is the environmental impact of each of these? What you're doing is taking the uterus out of this woman in each of these ways. Which of these is the most energy intensive, and why. The idea being that we can try to get the environment on the agenda of the surgical supply companies. If it turns out that throwing out very expensive robotic arms is very energy intensive, we want the surgery companies to say, oh, we care about this, we need to start making reusable instruments that have an environmental bottom line. We can't throw out the entire hospital every time a patient enters the door. There has to be at some point where we say, this is how much we can work towards reducing infection, and beyond that, it's either not helping the patient or it's too harmful for the planet. And I'll just end with this quote from Voltaire, which I think of all the time: no snowflake in an avalanche ever feels responsible. I love thinking about that because it can be so overwhelming sometimes when you're tackling waste and other environmental problems. So thank you so much. That's it.
I have to thank Mary not only for that presentation, but for all the really great work she's doing. That's going to change, hopefully, the way we practice in healthcare. And our final presenter is Nina Katkus, and she is a registered nurse and a geologist, which I think is an amazing combination. So she understands very clearly and uniquely the connection between energy, how we get our energy, especially from fracking, and how it affects our health. And she was instrumental in helping the PSNA, the Pennsylvania State Nurses Association, and the American Nurses Association craft a statement about what is the nurse's responsibility in understanding and disseminating information about health and energy. And she will be speaking about that statement. Thanks, Nina.
And I don't have any slides, so if we could cut that off. Really? It's blinding me. So it's always a problem when you have to rely on a couple of notes anyway. Yeah, I actually didn't know that we were bringing slides, so I just kind of left mine at home. I've been so moved by all of the presentations today and what I've heard about what's happening in medicine, of course what Healthcare Without Harm is doing, and Heinz Endowment certainly. I think I don't want to just speak to nurses right now. How many are not nurses in the audience? Okay, so it's good that I not speak to just nurses. But I think using this as an example, what we did as a nursing organization, to show what you could do through being active in an organization or even on a personal level. Thinking about climate change energies, as we saw this morning, really are energy issues. Those are the prime contributors toward climate change. Just this past week, I read where there were 3,000 high temperature records broken in the U.S. last year. That number boggles me. How many is that per day? Somebody help me out. But not only that, heat-related illness is the #1 cause of death in weather-related phenomenon. So beyond hurricanes, beyond tornadoes, which we know we were affected by those last year as well, heat-related illness, dying because people are affected by heat, kills more than all of that. So this is a human issue. It's a problem. What are we going to do about this? The Pennsylvania State Nurses Association, when we started, we have an environmental health committee that I'm one of the co-chairs, and my partner and I, the other co-chair, as well as our 40-plus members, were very concerned when we began to see the natural gas drilling in Pennsylvania. Perhaps many of you are concerned as well. As we heard more of the health issues that were emerging, we were becoming even more concerned. So we decided to write what was called an action proposal for our National State Nurses Association. the American Nurses Association. Every 2 years, they convene a House of Delegates, and this year was their time to do that, in order to vote and decide to read a number of proposals that have been put forward by state constituencies and to see what they wanted to address in the coming years, what issues were going to be on their table where they would be looking at advocacy. As I think Dr. Cohen mentioned, the ANA has been involved. They sued the APA. They were part of a suit in there when the APA was not fulfilling their responsibilities. So every 2 years, this House of Delegates decides, what are we going to work on? What issues are important to us? What affects the health of Americans? And on a more global scale as well. It's not just that they're concerned with Americans. So we, at PSNA, concerned about fracking issues, began writing a proposal about fracking. And through a number of submissions to ANA, because they don't just let your proposal go to the House of Delegates unedited and unviewed, and some of them never make it. Most of them never make it. So they kept sending us feedback. You need to make this more general. That was their number one feedback. We corrected all the other little things we thought were problems with our proposal. But we didn't really capture, weren't really capturing what they meant by general, so we just ignored it. We just kept submitting it. You can do that for 3 times, and finally on the second time we got it. We were hearing about our colleagues in West Virginia dealing with mountaintop removal, with the birth defects that children, babies being born in the valleys from leaching of heavy metals. We were hearing about many of the other issues associated with fossil fuel extraction and use. And the light bulb went off. That's what we should be writing about. Fracking is just a piece of the problem. It's becoming a larger piece of the problem, but it is still only one piece of the major problem, that we are using fossil fuels at a rate that is unsustainable and that at any rate is not good for our environment or for the health of humans or ecosystems. And second, the extraction of those fossil fuels are causing a large number of problems as well. So our document addressed those issues. Consumption of energy, the type of energy we're using, i.e. fossil fuels, and also how we need to move toward the conversation of developing sustainable energy sources. If we have to replace fossil fuels with something. It is naive to think that we can live in a world that we have developed now without energy sources. We see what happens in blackouts. People die. I mean, it becomes a life or death issue. Energy is required. We have to be conscious, though, of what we are leaving future generations as a legacy of our energy use. And since the 1950s, consumption in the United States in particular has far outpaced production of energy. We simply use too much. We could question whether we even need these lights, all of these lights on right now. Do they have dimmers? Is there some way to, conserve the energy as we have these conventions? How many of us carpool, here today? And admittedly, I didn't. No one was coming from Johnstown, I don't think, which is a ways away. these may seem like small things, but these were things that were, thank you very much. You don't need to see me anyway. But yes, we don't really need to consume as much as we think we do. Air conditioners, heaters, these little behavior changes can make a big difference in how much energy is used and how we go about making these changes for our future. We felt that nurses need to set an example. We felt that our voice in Pennsylvania was really not all that needed to be accomplished, that we needed our national organization to take a lead in this, to focus on these issues, to start that conversation for future generations that we need to stop using fossil fuels at some point. And we might think it's unreasonable to say stop, but they will run out. Those fuels are not being produced at a rate that they can continue to be used as they're being used, and they're not renewable. That's the bottom line. Somebody's going to be without one day if we keep using them as we are. So the ANA, the proposal that we put forth about energy conservation, energy use, moving from fossil fuels to sustainable energy, was passed by the ANA House of Delegates with an overwhelming majority. Now, we did also address fracking in this proposal, and in part of the resolution, we did call that ANA would call for a moratorium on new permits on high-volume hydraulic fracturing until the safety of the process could be determined. So that has been resolved. Now, the strategies that will take place in moving forward and implementing these things can take place at a legislative level with advocacy. We've already done that. We communicate here in Pennsylvania with our legislature. We advocate for cleaner energy choices. And we also, though, want to show individual nurses how they can do this as well across the nation, not just here. It's not only happening here in PA. These things are, if we're talking about fracking, it's being repeated in a number of states, Colorado, North Dakota, even in southern states, North Carolina. We don't know what's going to happen there yet. It's not just one thing, but again, we're looking at the entire spectrum of fossil fuels, not just concentrating on natural gas, although that's fossil fuel, as we know. I think, to me, I like using our native peoples. I'm Chickasaw Choctaw tribe, my mother, and I love how native peoples do believe that if the current generation will consider the future up to 7 generations, that what we do now to keep from adversely affecting them or preserving things for their use, that's the way to go. That's the good thing to do. And if every generation does that, then at least for 7 generations ahead, we're thinking in a much longer term than what we're doing today or even tomorrow. And I guess that's it.
Thank you very much, Nina. Oh, is this on? Okay. Because you'll never hear me if it's not. I want to thank you all for attending. I want to say that at Magee-Womens Hospital, we are so focused on education, which is why we were so happy to partner with Healthcare Without Harm to bring this forum to Pittsburgh. We're also audio taping it, so we're going to be able to share it with other groups. And that's in creating a green culture at Magee, in changing ideas like Terry suggested, education is absolutely key. So if each of you would take what you've learned and go out and share it with others and encourage them to attend forums like this.